Okay, good afternoon, everyone, and welcome to today's meeting of the Perth and Kinross Integration Board. If I can just start by asking the clerk to go through a roll call to ensure that we have appropriate attendance. Thank you.
Thank you, Chair. Good afternoon, members. When I call out your name, if you could just confirm that you are present in the meeting, and just to confirm that I've received no formal apologies for today's meeting. Councillor Duff.
Present.
Councillor McDade.
Present.
Councillor Purvis.
Present.
Bob Benson.
Present.
Peter Drury. Do we have Peter Drury?
I saw Peter earlier, but
I can come back. Ronnie Erskine.
Yes, here.
Pat Kilpatrick.
Present.
Gordon Patterson.
Present.
Jackie Pepper.
Present.
Jane Smith.
Present.
Dr. Lee Robertson.
Present.
Sarah Dickey.
Sarah isn't present, but Sandra Gourley here in Sarah's place.
Thanks, Sandra. And Bernie Campbell. Don't think we have Bernie. Alan Drummond. Alan. Stuart Holt. Don't think we have Stuart either. Sandy Watts.
Present.
Thank you. And Sandra Auld.
Present.
And Lynn Blair.
Present.
Okay, I'll just come back. Do we have Peter Drury joined us yet? I'm aware that Peter, I think, was on the call earlier, so hopefully he'll maybe join us when he can. So I think that's everyone at the moment, Chair.
thank you. And if officers can possibly try and contact Peter Drury to assist him returning to the fold, that would be very helpful. Before I give some introductory remarks, can I just move on to item 2 on the agenda and ask if there are any declarations of interest in respect of today's meeting or any items thereon? If so, please put DI in the chat or put your camera on to indicate that you wish to speak. Okay, there do not appear to be any declarations of interest. Okay, so thank you everyone for these preliminaries. Now, I wanted to start with some very important messages, and I would ask media colleagues please to assist in getting them into the public domain. Firstly, it is of course marvellous news that COVID vaccinations began across the country yesterday, including in Tayside, and there is hope that the end of this global pandemic may be achievable in 2021. I wanted, however, to stress that we all need to be very patient for potentially several more months while the vaccines are deployed across the adult population. To understand the scale of the challenge still faced if we are to get on top of this virus, we all need to recognise that in Perth and Kinross alone, almost 130,000 people from Kinlochranach to Kinross and from Crieff to the Carse of Gowrie will need to be offered vaccine according to the agreed order of medical priority. This is an absolutely enormous logistical and organisational challenge, made all the more difficult by the temperature requirements for storing the Pfizer-BioNTech vaccine. NHS Public Health Directorate and the Perth and Kinross Health and Social Care Partnership teams are working extremely hard planning the details of how this mammoth exercise will be undertaken over the coming months. Until there is more certainty of supply and timing of supply of approved vaccines, these plans are of necessity provisional. However, Gordon will set out where we currently are on this, including how we hope to vaccinate priority groups in phases 1 and 2, what the mass general population phase 3 may then look like, and how people will receive their invitations to come forward for both the initial dose and subsequent booster dose. Gordon will give that detail when he gives his report later this afternoon. However, in the meantime, I just wanted to reinforce 2 more vital public messages. Please do agree to receive the vaccine when invited. Even if you don't believe the politicians, please believe the country's best scientists and medical professionals when they say it is safe and strongly recommended. And also, please continue to remember the facts, including and indeed especially at Christmas. So that is, wear face coverings, avoid crowded places, clean your hands regularly, keep 2 meters distance, and self-isolate and book a test if you have symptoms. Secondly, while we await the COVID vaccine, there is something else we can all do right now to protect ourselves, and that is to get the flu vaccine if you have not already done so, especially people aged 60 and over who are able to book a free appointment through their own GP surgery to be vaccinated this coming weekend at special clinics in Perth, Blairgowrie and Pitlochry. Of course, it's not all about vaccinations, and our social care and health teams across Perth and Kinross continue to deliver highly creditable achievements in many areas, despite the challenges that are being faced daily. A&E waiting times are exceeding the stretching national targets. Delayed hospital discharges are lower than they have been for quite some time, thanks to some amazing work by all the teams involved. And other essential services are being remobilised as soon as they safely can be. And again, I would urge anyone who is worried about attending medical appointments, please don't be. You will be very safely looked after. So that's all I wanted to say. That there may be further. I may require to make further comment later on in the afternoon regarding other developments, but we can come back to that as required later on. So I just wanted to say these words as a matter of public record and ask our media friends to assist in communicating that as widely as possible to the people of Perth and Kinross. Okay, so without further ado and moving on, can I go to item 3 on the agenda and the minute of the meeting of the IJB on the 23rd of September. You will all have received a copy of the draft minute. Can I ask if anyone has any comments or observations or remarks on the accuracy or otherwise of these draft minutes? And again, I'm not seeing any comments coming into the chat box and no screens coming on. I'll assume therefore that there are no comments. Can I ask if these minutes are therefore approved? And I shall take silence as approval. Thank you.
Agreed.
Thanks very much. So moving on, and just before we go to well, sorry, I'll move on to item 4 at the moment and the action points update. And I would just ask Gordon to speak to the action points update at this stage.
Thank you very much, Chair. Good afternoon, everybody. The action point update that is included in the papers today relates to our intention to bring back to the IGB a report on progress in relation to the implementation of the Strategic Commissioning Plan. At the IGB having approved the plan a year ago, we were due to be bringing this update. However, the Chair may wish to highlight some of the changes to the agenda that have had to be necessary, this being one of them in relation to a decision that we took as officers and with the Chair and Vice Chair's support to defer this particular item, particularly because we, at a recent development session, had recognised the importance of managing the agenda to accommodate as a substantive item the input and presentation that you're about to receive in relation to the final draft mental health and wellbeing strategy for Tayside. So this item has been deferred and will be brought back in the new year at our next IGB. Thanks, Chair.
Thank you. Okay, so without further ado, as Gordon has said, we shall move on to the substantive formal business of the day. It is a busy agenda, and some items have, as members are aware, had to be deferred until the new year. Before we press on though, can I ask for the agreement of members, I would like to adjust the running order today, principally to accommodate the next item, which, as Gordon said, is discussion on the vitally important paper, which is the Tayside Mental Health and Wellbeing Strategy. And we have Kate Bell, the Interim Director for Mental Health and Learning Disability for NHS Tayside, with us to present that paper. Kate has also to deliver this report to Angus IJB later this afternoon. She hasn't quite mastered the art of being in two places at the same time, so we would like to accommodate her busy schedule by moving this item slightly up the agenda. Unless anyone is otherwise minded, we shall proceed on that basis. Does anybody have any comments to make on that? Okay, thank you. So with everyone's agreement, what we will now do is have item 6.2, the Mental Health and Wellbeing Strategy, followed by item 6.3 on the redesign of substance use services and the impact of COVID-19 in Perth and Kinross. After these two substantive items, we will take a short comfort break, and when we return from that, we will move on to the Chief Officer update, followed then by the Audit and Performance Committee update and the financial reports, before concluding with matters for noting and question and comment as necessary. My ambition is to conclude this meeting by 4 p.m. if at all possible. But of course, I will not stifle debate, but I would ask everyone to ensure that their questions and their comments are as succinct as possible. Okay, so without further ado, if we can just move on now to item 6.2, the Tayside Mental Health and Wellbeing Strategy. Good afternoon, Kate. I ask you to speak to your report, please.
Thank you very much, Chair, and thank you very much for all of the accommodations that you've just mentioned in your preamble. I'd like to offer the Chair, just in terms of, I spoke to the IGB development session only weeks ago and delivered a very similar presentation. I'd like to offer the opportunity to, if you'd like me to go through the presentation, I can. I'm not sure how long you've slotted for this agenda item, or I can take you through the paper and indeed then open up to questions. This is probably the third occasion that I've presented to Perth and Kinross IGB on this topic, So I'm really open to you in terms of what do you need me to take you through today in order that we can talk about the final draft mental health and wellbeing strategy. Thank you, Chair.
Okay, thanks, Kate. Yeah, I mean, if you could perhaps, I appreciate that not all board members were present at the development session, so I would be obliged if you would give some summary remarks. I'm sure everybody has read the paper, but if you could give some summary remarks and talk to the salient points, and then hopefully if there are any questions you would agree to answer these thereafter.
So just for clarity, Chair, you wouldn't like me to go through the PowerPoint presentation?
Yeah, well, yes, I would, but if you can, I mean, accepting that you have gone through it already, if you could do it just relatively briefly, but picking out the substantive points as you see them. Thank you.
I will do that as succinctly as possible. Thank you, Chair. I assume that we have someone who's controlling the slides. If we could go to slideshow and go on to the second slide, please. So thank you very much for the opportunity today, members of the Perth and Kinross IJB, your Integration Joint Board. I hope my introduction is not new to you. I'm Kate Bell, the Interim Director for Mental Health, as the Chair has already said. I'm here today to present the final draft Mental Health and Wellbeing Strategy after a period of some 9 months of co-creating this with a whole variety of stakeholders. I'm delighted to say that we are on track to launch the strategy after going through this process with yourselves, other IJBs, other local authority committees, and indeed the NHS Tayside Board to seek endorsement and approval on the final draft strategy to allow us to move forward. Thank you. So the slide deck that you have breaks down the strategy, but if I can say that the strategy begins with the independent inquiry into mental health services that was concluded in February 2020. And most people in this room and on this call will know the 51 recommendations. We've been discussing them since March of this year. We have them in a programme which is Tayside Executive Partners Response to the independent inquiry, which was accepted by the NHS Tayside Board on the 27th of February. And some of you on this call are members of the NHS Tayside Board and were present at that meeting. The 51 recommendations have been set out in an action plan called Listen, Learn, Change. And again, I won't go into the detail of that for brevity. It's important to say that we are some way through implementing that Listen, Learn, Change plan. It forms part of our strategy, and indeed it forms part of the change programme for those aspects of the 51 recommendations that will not be delivered by December or January 2021. Some of the actions within there are longer standing actions that we need to put project support around, that in order to deliver long-term sustainable change, we need to put a robust plan around. So there are 11 of the recommendations that will find their way, as we've agreed, to be merged with the future change programme. The timeline that you see along the bottom there has been adjusted in terms of Dr. Strang review will now take place in April, and most of you will know that. Then Dr. Strang review will report out in June. It will not affect the timeline for the delivery of the strategy, but it will give us an opportunity between January or say February and April to continue to engage the public in terms of our ongoing mental health and wellbeing strategy. Next slide, please. This slide was created in terms of, again, that co-creation model was that we have co-created a strategy and a vision that has gone with that. But we've gone back to the formula of Listen, Learn, Change. It wasn't just a strapline in a response to the independent inquiry. It was a behaviour that we were asking people for in terms of, have we listened? What matters to you? Is it a two-way communication that we've got in terms of listening? Are we listening to you and responding to you? In terms of that learning, have we been humble in our learning and listened to people with lived experience and actually understood what they've asked us to do? I hope the strategy does demonstrate that and reflect that in terms of that co-creation process. And very much the change programme does reflect opportunities to shift the balance of care. So having listened, having learned, does the strategy say all of what we have heard over the process? And that's going back to the 1,500 voices in the independent inquiry, but the over 800 voices that we've heard now through the programme, and from other focus groups and other organisations, it's difficult to know what the reach of our engagement has been over the last 8-9 months. Next slide, please. So just to take from this that it's important that the foundation of all of our thinking is based on what's driving change in Tayside and in Scotland. So these elements here are what have driven the scope and the scale and the Tayside-wide nature, the system-wide nature of our mental health and wellbeing strategy in Tayside, and indeed that change programme. That what we're saying is that if we don't tackle these issues, then sustainable change over the next 5, 10, 20 years for mental health will not come to fruition. So we put the strategy in this context, and most people who've been involved in it will know that we talk about inequalities, we talk about the complexity, we talk about the more older people, higher demand. The strategy is set within that context, and we can come back to that in terms of any Q&A that you might want to go into. Next slide. So again, scope of the strategy, we've covered this ground before, but it's important to revisit it. When you look at the strategy, it's a lifespan model. There are some slides here that talk about how we've co-created that model, what this strategy is called, Living Life Well, a lifelong approach to mental health in Tayside. So this is the background to that in terms of what we've co-created. The scope of the strategy is pre-birth to old age, so perinatal mental health to older old age psychiatry. Previous slide in terms of the changes in the determinants from prevention through to recovery. And again, that's the entirety of the system that we're working within in terms of the strategy and the change programme. Thank you. So from a strategic planning point of view, it's important, I guess, in terms of all healthcare services and all social care services and all public services that we sit within that triple aim, is that what we're doing to improve population health and designing this from a mental health perspective. So how do we improve mental health in Tayside? How do we improve the quality of the person's experience within mental health care? And how do we optimise our resources within that? And I think what we've discussed over the period of time, this is very much a healthcare approach in terms of the 6 dimensions of quality, but I think it works very, very well for the entire system. And more importantly, it works for people who receive our services to ensure that they are efficient and effective, that they are person-centred, that above all, that they are safe. And when we talk about equity, that's not necessarily equal, for everybody, but it's equitable in terms of that everybody has equal access and timely access in terms of waiting times. We all know the stories around those. So those 6 dimensions of quality are really important to the overall strategy. And to answer the so what question, have we made services more effective, more efficient, and so on? Thank you. To put the mental health and wellbeing strategy in context, we are saying that mental health is everyone's business, not just from a system-wide multi-agency point of view, but from every individual's point of view, that we all have mental health that relates to how we think, how we feel, and how we interact as people. It's none more so than through COVID that people have become closer to this agenda in terms of what is absolutely important to them. And our emotional, psychological and mental health and well-being is absolutely up there with that agenda. Important that we tackle stigma, discrimination. So therefore that's what the strategy is talking about in terms of its good mental health for all section. Thank you. Some of the statistics in terms of our strategic needs assessment, which is now in a data compendium, which is a sister document for the strategy, talks about these 4 or 5 things in terms of the severity of isolation that people have experienced, the rates of depression in terms of how that relates to people with long-term conditions, so physical health and mental health, how we bring those things together. The rate of suicide is substantially higher amongst men than it is amongst women. There is a significant amount of data around suicide prevention, and we know that that's a priority for us in our strategy in terms of moving forward to make the necessary changes that we need to make in the system. People with severe and enduring mental health problems. I think something that has come out of our co-creation model is that people understand better that we are always going to have a requirement for specialist mental health services, that we're not always going to be able to prevent, mental illness or mental health disorders. And that's been an important learning point, for everyone in terms of what the future system needs to look like. Next slide, please. Deprivation, back to the social determinants, but building resilience in our communities is something that I have heard a lot from the people in Tayside in terms of the tailored nature of some of the work that we've done. How do we get down to localities? How do we get down to neighbourhoods? How do we get down to streets to ensure that that resilience is there in our communities, and that access to the right service first time is what we are working towards. Thank you. So, trust and respect, the independent inquiry talked to people, but also talked to staff, it talked to high numbers of staff. And our organisations have values, they have a value base, we want to make that more important, we want to listen to what staff have told us, and the staff working in teams across Tayside and to move to that joy in and at work is our main objective. And we know that as staff and morale is better and morale is increased and improved, that we have patients, being provided with the highest quality care, which again is one of the major aims of the strategy, is to deliver those world-class mental health services in Tayside. Thank you. So again, this is just an evidence of our engagement. I won't spend any time on this. It's there for people to look at. It was a snapshot of where we were at the 6-month rate, but it did give that programme summary. We've now moved on to 2 new newsletters beyond this, but it gives that we have been collecting data from day one, and we're able to evidence all of the engagement that we've had to date. Next slide. This is a slide in terms of 10 high impact changes, and again, it's a pictorial, diagrammatic figure in terms of how we've communicated with people. It's been important for us throughout the period of our entire engagement to ensure that we were using mediums that were engaging for people. So therefore, at the point in time, we came up with these 10 high impact issues and 10 high impact changes based on the engagement that we had today. And it went back to the statement of intent in January, and it takes us through to what we want to deliver is that focus and development on those world-class mental health services. But you'll see throughout that, it comes out to you in terms of what was in trust and respect, around people, around culture, leadership, change. What is our strategy? Do we have a strategy? We now do, and this is what we're here to present today. Some of the high impact areas are there for you to see in terms of the adult mental health inpatient redesign, urgent care for mental health, what does that look like across Tayside, suicide prevention, mental health being a public health priority. I could break these down. This is actually an interactive document. If we had the interactive version of this, you'd be able to scroll over this and go into it in more detail. So again, that is a bit of a poster that we've used. Next slide, please. So in terms of the aims of the strategy, we've used these types of slides as a bit of a summary in terms of some of our engagement, albeit that we came to this a bit later. At our November meeting, we created what we called a summary document. Some people called it an easy read, but it was this kind of information that was in there about answering the so what question. So what are the aims of the strategy? What does the strategy aim to do? So the bullet points that you see here, again, I'm not going to read them through. It is about those high-level messages in terms of what the strategy is about. Move on, please. Again, strategy aims, number 2, those high-quality services. I think everybody in this room and in the rooms that I'm going to be speaking to in the weeks to come, that this is policy, this is practice, this is what we've been asked to do, this is what we've been asked to work towards, is to ensure that we can have those much more community focused, community delivered, building that capability and capacity for specialist mental health services, but also for better upstream intervention and accessibility of mental health, whether that's through NHS 24 or through our general practitioners or through our community teams, and to ensure that we optimise and only use acute services when they're required. Thank you. This is the governance chart for the change programme, and again I've discussed this at length in other meetings. The second part of the strategy goes into the change programme in greater detail across those 6 projects, into those work streams, and we are some way through actually producing the full documentation set for this change programme. As I said, the reason why you have 100 pages is that we want to ensure that this is not a strategy that sits on a shelf, that we've actually described how the strategy will be delivered and implemented over the period of time. I'm happy to come back to that slide in any more detail during a question and answer. Thank you. This slide here sets out 6 boxes in terms of the various 6 programmes, and again, just to give the IGIP an assurance in terms of how we've communicated with people. These illustrations are how we have focused our work with people, not necessarily on meetings, but much more so on how do we bring alive, the scope and the scale of each of these projects. So the illustrations that you see were drawn by an artist that's employed by Tayside and Scottish Government on the Tayside Mental Health and Wellbeing Programme. Just again an illustration of our communication and engagement and co-creation model. Thank you. This comes back in over the next couple of slides. If I could just ask you to flick through these. This is the vision and some of the work that was done by the Communications and Engagement Group to come up with that preferred title, to come up with that vision in terms of living life well, a lifelong approach to mental health in Tayside. If you just want to flick through the next 2 or 3 slides, that will let you see what the Communications and Engagement Group have come up with in terms of they have co-created this for us on our behalf in co-creation with us. The website is there. Yep, if you want to flick on, that's perfect. So you see the website here. All of our documentation is in that. The previous first draft strategy is there. The final draft strategy is there. We have a video that is 3-4 minutes long, again in terms of that accessibility to the message as to what the strategy is trying to do. So I would recommend the website to you to go and have a look and to look through our October newsletter, our November newsletter, all of it is there on the website. Thank you. So this is our Creating Connections, again, which has been co-created with the Communications and Engagement Group. The membership of that group is primarily third sector organisations and voluntary organisations and individuals with lived experience. It's chaired by a young man called Brooke from the third sector, Feeling Stronger, I think is the name of his organisation, and our Director of Communications, Jane Duncan. Thank you. You can see the themes that have been brought through. They've actually come up with a colour palette, they've come up with so many different things. And we have a media champion, again, who's a member of the third sector organisation. I think it's, that has encouraged us from a communications and engagement point of view to build a relationship with the media, to be writing these press releases in a proactive way, to be encouraging, better coverage of mental health in Tayside. Thank you. So again, back to our co-creation. This is, I hope, what the final strategy will look like in its final production. At the minute we have it in a dull A4 format with all of the narrative that's there. This is the co-creation model that has been produced by the Communications and Engagement Group. It's been shared with the Mental Health and Wellbeing Strategy Board. It's been shared with the Writers' Strategy Group and a whole host of other people to come up with this as a reflection on what mental health and wellbeing in Tayside will look like. Thank you. Recruitment and retention. One of the big things I think for all of us over the last 8 months is about how do we attract, how do we recruit and retain people into mental health services in Tayside. We've put the example up here of the Director of Mental Health. So we have recruited to that post, and that post is now in shortlisting and awaiting an interview date. We've also recruited to consultant psychiatrists in the same way. I actually have a copy of the BMG here on my desk where there is a double advert page that's been taken out. We have these things on job train, but we have set up part of the microsite to ensure that we are making Tayside a more attractive place to work from a mental health perspective. So our recruitment and retention strategy is wrapped around that. But you can see this is not your normal ad. We are trying to make these things much more attractive so that they stand out in a very, very competitive market. Thank you. So I would just skip on to the next few slides. This goes back over the vision that we've set and some of the characters that are there. So the next few slides I will take to an end, Chair, and thank you for the time, is to say that what will be different for people is that these things are set out very early in the strategy, because we always set out to say that the mental health and wellbeing strategy in Tayside is about people. So therefore, people will look to be equal partners with the clinicians. That's something that we've been asked for. It's something that people want to be heard in those consultations. Much more realistic medicine approach, that people will be supported to reflect and express their own preferences, whether that be for medication or not medication or for some other type of intervention. And that there are similar options, simpler options that are that people are asked to look at. That they would be supported to have confidence in the knowledge and understanding and skills that they can live well in terms of self-care, and that they have access to greater support in terms of those support and services that would be available in the community. Next slide, please. Are you able to move on to the next slide? Yeah, got it. So again, this is important for us. If we just go back to the previous slide, it's important for us to say that people come first, and these are some of the things that again will be new to people in this room. And I hope that you recognise that we are working towards a shared agenda and to shared outcomes. That individuals will benefit from care closer to home. That's absolutely the driver for change. That health and social care professionals will work closer together in relation to mental health. That multidisciplinary and multi-agency working will be the norm going forward. That in terms of hospital-focused care, that will only be for the shortest period possible. And again, that will be part of a care plan approach, which will show that joined up working across the entire system. Next slide, please. So the next two slides talk about workforce, and then I think we come to a close. That again, in terms of a workforce strategy, the strategy for mental health and wellbeing has to have an accompanying workforce strategy. If we're talking about working across the system, I think we're all working at the minute in terms of increasing the capacity in communities around mental health. We have got some government funding to do that. We need to work closer with other agencies to see how do we optimise those multi-agency teams working together. How do we do that from an adult support and protection point of view? How do we do it for children and young people? And how do we ensure that we join that up for adults at the same time? So our workforce has to reflect the requirements around our delivery. So building that mental health capacity and capability around our communities and in local GP practices. Thank you. So what will be different for communities? Again, this kind of reflects on what will be different for individuals. But care closer to home, again, easier access to the right supports, the right person first time and getting that treatment. Families will receive mental health delivered in primary and community care settings. If we're able to get the workforce right, then it changes the game for people in terms of their mental health and wellbeing in the community. And you would imagine that we can work with all mental health conditions up to extremes of exacerbation in the community if we have the right workforce and the right people in the right place at the right time. Thank you. This is the timeline that we're working towards. I think you're very much aware of, this is for your information in terms of all of the groups that this report will go to for endorsement and approval towards the launch in January. Next slide, please. Okay, so thank you, Chair, and over to you. Sorry, that seemed like quite a slow process. I'm open to answering any questions in relation to the final draft strategy that you have ahead of you. The recommendation is that the Integration Joint Board endorse and approve the strategy going forward. It's important to say that the financial aspects of this that are written into the strategy are high level. They're high level for a reason. That these are the strategic intentions for mental health and wellbeing, and we would hope to come back as part of the living document to the IJB in the future with a more detailed programme delivery plan, which will have more succinct financial planning around it. Thank you.
Okay, thank you very much, Kate, for your presentation. And whilst many of us have seen this and received the benefit of your presentation before, it was important to go through it for those who hadn't previously heard it, and also obviously for members of the public and press who are in attendance. So thank you for that. I'm going to now put it open to questions from members. And again, if you're able to use the chat function, please put Q in the chat. If you're not able to use the chat function for whatever reason, if you could possibly just put your camera on and wave your hand, then I'll get to you. And just while I'm waiting for any questions to come in, can I just ask for the minute to record that during the course of the presentation, we have been joined by Bernie Campbell, the Carer Public Partner, and also by Peter Drury, one of the voting members. And thank you to both of them for persisting. I know there have been one or two technical problems again today, but we're in, so that's good. And thank you for joining. Okay, so I have a question, first of all, from Councillor Duff.
Thanks, Chair. I just wanted to thank Kate for the presentation, and it's obvious that there's been a tremendous amount of work and consultation that's gone into the process. I think also too for the manner in which the work has been approached. I think there's been a lot of effort towards greater inclusion, engagement, and looking at tackling inequalities in the system. One of the things that's in the strategy is about the roles of different professionals, and Kate talked about recruitment and the workforce plan. And I just had a question around about, how important to the strategy the recruitment of additional psychiatrists is. How many do we need? Have we advertised for them? If so, when do we anticipate they'll be recruited? Thank you.
Thank you, Councillor. Yes. In terms of, I appreciate greatly the comments in terms of recognising the depths that we've gone to, because the raison d'etre is to ensure that we can deliver better services to the people in the population. So therefore, that's who we need to listen to, and we've attempted to do that in great detail over the last 8 months, and I hope the strategy reflects that. In terms of your second question, there is a competing demand across Scotland for consultant psychiatrists. The strategy talks about a changing model for mental health in terms of our service model, moving more towards a multidisciplinary team approach. So therefore, less reliance on consultant psychiatrists and maybe more of a team approach around the use of psychologists, the use of advanced nurse practitioners, the use of allied health professionals. So that's shifting the balance of care. Is not only shifting the balance of care from one side of the service to another, it's from one person to another in relation to that. So we are currently, in terms of our workforce strategy, looking at if we were to shift the balance of care in the future, how many consultant psychiatrists will we need? So therefore, we're looking to identify that in a much more intelligence-driven way in relation to that. However, from our current position, our priority is to ensure the continuity of care of people who need to see consultant psychiatrists. So we are making use of some locums at the minute. We do have an add-in which went out in late November, and we have already set the date for interviewing those people in the first week in February. And that is also to recognise the next outtake of doctors who are coming out from their training. There's also a good news story in Tayside where we have 3 trainees coming through who are contemplating staying in Tayside, which means that our recruitment retention plan is working. And those 3 will therefore take the position of 3 temporary locums. And I'm sure the Chair and others will appreciate how much that will affect our financial standing in relation to the overspend that we have around our medical staffing. So our strategies around all of that, Councillor Duff, I hope that answers your question.
Thank you. That's very helpful. Thank you.
Thank you for that. And now, Ronnie Erskine, you have a question.
Thanks, Chair, and thanks, Kate, again. I really haven't seen this process for several months now. I think it's been quite exemplary, the way we've gone through the management of the project and the different stages. All of the engagement at a time when face-to-face meetings have not been possible in many cases. So I really feel we have got somewhere on time, and it's quite an excellent planning and strategy document. So we're at a really good place at the moment in terms of setting out what we need to do. Of course, there's always the caveat to that, which is we need to then turn that into reality and delivery on the ground, which is, given some of the comments that we received as part of the earlier review, is going to be a considerable challenge for quite a number of years, I suspect. So I guess the questions I had related to that area, 3 questions really. One which has come up in conversation before, which is around the whole value-based culture change that's referred to in the document, and we've had excellent engagement with stakeholders up to this point in time, but to actually convert that again into a culture change amongst staff and other partners is quite a big challenge. So I wondered if you would maybe want to say something about how we can continue with the buy-in that we've had up to this point, how we can continue to secure that, because there will be bumps in the road over the next year or 2 ahead. So that was my first question. My second question related to resourcing, and everything comes with a pound sign, I think, and there could be a bit of a large pound sign in terms of the delivery of some of this. But what I wondered was, if it turned out that the resourcing available wasn't sufficient to meet the aspirations in the strategy, do we know how we would prioritise the different elements that we've identified? For example, I think on page 28 we've got about 40 different measures of success, which are excellent, but very stretching and ambitious. So my second question on resources, I'm trying to keep it short, Eric, and my last one on risk. What would you say, in just very summary terms, in your view, would be the key risks to the delivery of the strategy? So I guess strategy, risk and culture, 3 fairly minor issues. That's maybe 2 minutes. Thanks.
Okay, thank you for that, Ronnie. And again, thank you for your kind comments. Planning complex strategic change is an art and not a science in some respects, but we have managed to do that pretty well here in Tayside. But to take us back in terms of our value base and our culture and some of the change for staff and partners, let me add people with lived experience to that. Let me add the people that we deliver our services to. If I was to say in terms of culture change, the leadership that we put in place, around mental health in Tayside, the partnership that we've developed in my time here over the last 8 months, there is a sense of shift, movement, to much more collaborative working. We talk about staff in terms of staff feeling listened to. Again, in terms of my closer working relationship with general adult psychiatry inpatient staff, that some of the changes that people are seeing in there in terms of their ability to work more in cohesive teams, in relation to across the system. We have now an integrated leadership group for mental health, which actually meets fortnightly. I chair that meeting, and we consider together, what the priorities are in terms of service, business as usual service, not strategic, in relation to how we go forward. So that's a culture change, that's a shift in terms of how people work. But here's what I've heard in the last couple of weeks. I've heard throughout the strategy, but more so in the last couple of weeks, is that I've had service users come to me, people with lived experience, to say that this is a game changer. This is there are green shoots here. There is a real shift in terms of how NHS Tayside are working. I did have to correct them to say that this is across Tayside and not necessarily just NHS Tayside. The changes made where people have been listened to, and the strategy now shows evidence of that the work that we're doing going forward, that co-creation and collaborative model, that sometimes we see a lot in documents, but people are seeing the evidence of here, and I hope, and that's the feedback that I'm getting, Ronnie, so I'm feeding that back to yourself as maybe evidence of a real culture change in terms of for the future. And I'll finish that off by saying that just yesterday in our programme board, and there are some of you members who sit on that programme board, we talked yesterday about a lived experience network for mental health in Tayside. That for me is the sustainability of this strategy. So we will put in place an infrastructure for the next 3 years as an implementation delivery infrastructure, but that will be infiltrated at all levels by people with lived experience. So that's where the accountability and the sustainability of these types of programmes come in. So I'll come back to risk. What is the biggest risk, I think, for the programme is that we don't put sustainability in place. The resourcing isn't available. So this comes back to the IGIB and all of the IGIBs in terms of where we go in terms of financing this strategy. So it's not just IGIBs, it's NHS Tayside, it's our local authority partners, it's the alcohol drug partnership, it's the community planning partners. If we mean what we say in the strategy and that it is service-wide, system-wide, then we all have to look at what resources we have to put into mental health in order that we can improve the mental health of the population. Thank you, Ronnie.
You're happy with that, Ronnie? Yeah.
Yes, thank you. That's great. Thanks, Kate.
Okay, thank you. Moving on, we now move to Pat Kilpatrick. Pat.
Hi, Kate, and thanks again for such a good presentation, and the fact that it's the whole strategy is driven through engagement and patient and carer and third sector input, I think is really the secret to all of this. My question is, and I looked at your sort of project chart of how the strategy breaks down into a number of projects and then who's leading what, and I'm raising the issue of the integrated substance misuse and mental health service. Obviously, we've had as board members, we've had a degree of frustration over the last couple of years about the time that it's taken to bring those services together so that they deal with the patient holistically, not just to someone with mental health or with a secondary issue of substance misuse or the other way around, but as a whole person who is suffering the impact of both of these issues. And the question is, I see that the lead is Emma Fletcher, who probably is the busiest woman in the NHS Tayside, and so much in demand. And I'm just wondering, Kate, if we're going to make reasonable progress with this, because she's obviously very tied up with COVID and she's tied up with the vaccination programme, and that's going to take many months. And if we talk about a third wave, and I worry that we could be here in 6 months saying what's happening re the single pathway now. Everything that you've produced is very robust, and I understand that. I just wonder if maybe we need to rethink who leads that, how it's led, and how quickly. And I think I speak for a number of my board colleagues about the frustration around that. How quickly could we get that single pathway and that holistic approach in place? And I think if we're waiting on Emma Fletcher, that could take quite a long time. So it's just a thought around that and how best we can support you and help you as board members to get resource to get that moving. Thanks, Chair.
Thank you for your question, Pat. And You'll be relieved to know that Emma is a figurehead lead for this from a public health perspective. Diane McCulloch from Dundee, from our local authority colleagues, is leading on this, linking into Simon Little, linking into other people in terms of the ADP. But we're also looking to Healthcare Improvement Scotland to support this from a government perspective in relation to linking up the Dundee Drug Commission, but also linking up to the early intervention in psychosis. So we're putting all of these things together to ensure that we can actually deliver that single pathway for all of that with the improvement support of Healthcare Improvement Scotland. And I have to say that the project brief for this is pretty close, Pat, in terms of coming together. I have a meeting with Healthcare Improvement Scotland on Monday the 14th, which is just this Monday coming, to look at what their plan is to overall support this work. And it is an absolute priority. I think it will be an exciting piece of work, and I don't see it taking years to pull together. I think within the next 6 months we could see at least a preferred model. You know, if we go through the process of what I spoke to the Minister about, was who's also keen and an urgency around this, is to say that we have to ask people with lived experience of mental health and substance misuse what they need most, so that we design the service around them. In the same ways that we're engaged around the strategy, to make sustainable change, we have to know what the issues are and we have to plan on that basis. But I can't sit here and say that it will be done in 6 months' time from now, but it is a priority and there is a project team around it.
Thanks, Kate. I appreciate that.
Thanks. Thanks again, Pat. Okay, we've got a couple of questions still in the chat bar. First one is Councillor Purvis.
Thank you, Councillor Drysdale. I was going to ask my question now and have a comment later. Is that fine?
Of course.
Yeah. Okay. Thank you again for the presentation. My question follows on from some of the questions that I asked in the private briefing session that we had, which again was very helpful. So thank you for that. It was just on the issue of the rapid review and the expert panel that has been set up to consider the redesign programme. I know we discussed that, and there's a lot of detail in the report on what that will look at. I'm just wanting to confirm that it will be open to that panel to recommend, should it see fit, either stopping the current project entirely or doing something different that, while clearly you're not going to be able to give an indication of what the outcome would be, but I just wanted to seek clarity that all options are open to that panel and that there's no restrictions on what they might recommend.
So I guess in terms of we have opened up the review. We have had one meeting already on the 21st of November, which I attended for the entirety of the session. The openness in terms of the options available to that group of people, to that process, is to revisit the option that went to the boards, that was approved by the boards in, I think it was January 18, and that was revisited again in September 2019 by the Perth and Kinross IGP with Dr. Strang. And at that point, it was decided not to pause the work, but to continue to do the work within the context of a wider strategy. So between September 2019 and February 2020, there was little done about that. We have to be honest in respect of that. So that's why we are revisiting this as part of our 10 high impact changes. So within those constraints, then that group of that expert panel will uncover, is that option contemporary? Is it fit for purpose? Is it where we need to go? We would then be looking at the detail, the data, to make that an intelligence-based conversation with that expert panel, which includes people with lived experience, includes first sector organisations, in order that we can do that with some rigour and a robust planning process. So the science will take us through that. So yes, people have the option then to come back to say, within the contemporary confines of what we have available to us, this is the best option for mental health inpatient services in Tayside. And we've separated out learning disabilities in that because as part of the overall change programme, we're also looking at what is the best service model and service configuration for learning disabilities in 24/7 in conjunction with our community colleagues. So both of these things are about what is the best possible service for this patient group in Tayside and where should that service sit. Does that answer your question?
Yes, it does, and thank you. And Chair, if I may very briefly just comment on this specific point, I think it is very welcome, the approach that you're taking. I know there were lots of different views in the past on it, but I think whereas maybe there was a feeling in the past that you mentioned about carers and people with lived experience being involved on the expert panel directly in making those decisions and informing that decision, whereas in the past it might have felt more a bit of consultation and engagement but not actually being fully involved. So I think it's a marked improvement, the approach that you're taking, and thank you again for that reassurance, not to prejudice the outcome, but I think it's really important that any decision will have buy-in from everyone. So thank you. I'll come back later.
To give you an added reassurance, Councillor Purvis, is that will have to come back to the Information Joint Board in terms of any proposal that we make, that we would be doing that jointly.
Okay, thank you for the questions, answers and comments, all very much appreciated. Now moving on to the last question that's in the chat bar is Sandy Watts. Sandy.
Thank you, Chair, and thank you for the presentation. The Third Sector Forum met on Monday and we were able to discuss this. We certainly welcome the strategy, and in particular we noted how well the third sector is shown to be a key partner throughout the strategy, which is great because sometimes it feels as if we've been a bit of a tack on at the end, and that certainly wasn't what we felt throughout the strategy, so thank you very much for that. However, a couple of points. One was in talking about engagement, the strategy includes a section on the 3 TSIs in Tayside, but it doesn't make any mention of the Perth and Kinross Third Sector Health and Social Care Forum. Previously, the IJB has recognised the forum as being a key partner, and third sector representatives for the IJB and for various programme and planning groups have come from the Third Sector Forum. So we were disappointed that we were not included as a key partner in that section. Also, the section which talks about the service model in mental health and talks again about engaging with the third sector, and it gives examples of key services provided, including mother and baby groups and lunch clubs for older people. We felt this paragraph was very disappointing in that it fails to recognise the full value of the third sector work and doesn't reflect the key role of the third sector in prevention and early intervention in particular. And I'm not belittling mother and baby groups or lunch clubs, because obviously they are important services, but the third sector is directly involved in delivery of community-based mental health services, such as counselling, advocacy, peer support, self-management support, and we would have liked to have seen that reflected in the strategy and wonder if that is possible, that we could be better reflected at this stage. Thank you.
Sandy, thank you so much for your comment. The strategy is contributions. So therefore, my apologies if we haven't captured your contributions in this. In terms of the Perth and Kinross Forum, what we try to do is to work from a strategic context in terms of the TSIs. But the reason for coming to the IJBs and the councils and the NHS board with a final draft strategy is that it is flexible to take on board these comments, and it is flexible to include, other things in the strategy for the final production of that strategy. So I'm pleased to say the answer is yes. If we can, accommodate some of your thoughts, especially in the service model section. So in co-creating a strategy, there's nothing in there that hasn't been contributed. So my apologies if we haven't found you and captured your views and got them in there. So we do have an opportunity to do that now in relation to enhancing that service model, because I'm very much aware as the Interim Director of Mental Health that going forward in terms of any mental health and emotional wellbeing services will be delivered by the third sector. So absolutely an equal partner in the delivery of mental health and wellbeing services. So I look forward to receiving that maybe by tomorrow, Sandra. That's a joke, by tomorrow. If we could receive it over the next week or so, that would be great. happy to work with you on that.
Sorry, you're just on mute there, Sandy, but I think you were just acknowledging.
Sorry. Yes, indeed, no problem, and thank you very much, Kay. So I'll get that to you.
Thank you.
Okay, good stuff. Okay, there are no more questions. At this point, I'm going to ask for any comments, and just but before we just throw open to general comments, I would just ask members to bear in mind that what we are being asked to do here is to approve this strategy, to endorse and approve this strategy, but with some form of acknowledgement and rider with consideration to the financial consequences of this, and being able to finance this greatly anticipated and very welcome strategy by all accounts. But if people can reflect their views in general in the comments section now, that would be much appreciated. And I see Councillor Forbes is first with his request for a comment. Councillor Forbes. Sorry, Councillor Purvis, beg your pardon.
An interesting comparison that's not been made before, but okay. Thank you, Councillor Drysdale. A number of comments. A lot of these I made at the briefing session, but I think it's important to air them publicly as well. I just wanted to first say thank you very much to Kate and her team for the approach that they've taken here. As I think I said at the briefing session, and she and others on the IGB know that certainly some people like myself and others approach this with a degree of scepticism just because of things that had happened in the past. And I think that what has been demonstrated in this is a really marked change in the way that NHS Tayside, the IGBs and other partners are engaging on this issue. I think more generally the engagement with carers, service user representatives has been a lot better, and certainly when I've spoken to some of them outside of this meeting, that's been the feedback that they have had. You know, I know absolutely the comments that that Sandy Watts has made, but I think again it's really good that this strategy comes to fora like these, so that those comments can be made and incorporated into the document. As I've said before, you know, it's a case of the proof of the pudding will be in the eating. So you know, it's about seeing how this strategy is delivered on the ground. I'll just make a few other comments on some of the specific points. As I said before, I really welcome the emphasis on realistic medicine. You know, I was shocked when I saw the figure about in Dundee that 1 in 4 adults are on some form of antidepressant. And while realistic medicine is absolutely not about saying that people who need medication should not have it, it's about ensuring that the options that are available to everyone are best suited to that individual. And I think, as I said before, that maybe in the past there was at least a perception that that wasn't the approach. So again, I think the clear and stated focus to have that as a core principle of how we look at medication in Tayside when it comes to mental health is very, very welcome. I also think that it's very important that we do engage with the third sector. I think they will be really important in delivering this strategy on the ground. There's a number of other things that I would like to revisit when we come back to the actual implementation on that. I've mentioned these before about longer term service level agreements and the agreements that are decided with the council. Often 1 year settlements is not enough for organisations that maybe don't have a lot of money and that a lot of their income is coming from these contracts. So I think that's important, and also a shift to more outcomes focused indicators of their performance rather than necessarily trying to dictate how they deliver their services, which not in all cases, but in some cases has been again the perception in the past. I also think that some of the comments about in suicide prevention in the paper are very welcome. The fact that through COVID-19 the timely data in Tayside has been used on a national basis as well, given the information is not available in other areas. I would just repeat as well that I think that's really important that the third sector carers organisations are able to access that data as well, and the learning from any of the discussions that take place after a suicide. I think finally on the substance of the report, I also welcome the outcomes focused approach that's being suggested for measuring progress going forward, the Living Life Well indicators. I think perhaps Kate suggested I was maybe a bit too eager previously. We need to get the strategy agreed first, but then once we've agreed that, I think it is really important that there is a way of measuring that. But what I would say is that, particularly in relation to recommendation 1 from the report, the final report of the independent inquiry, we almost shouldn't need to have any indicators to see whether it's worked or not. It should be obvious to everyone, staff, carers, service users, that the recommendation has been met. That's not to say I really support having measurable targets and outcome-focused indicators for all aspects of the strategy. But at the end of the day, in a few years' time, if you ask someone, they should be able to know without looking at specific indicators that there has been an improvement. I think that's almost the greatest test for us. Just finally on governance, and this is something that again I've raised a lot in the past, I would again like to repeat my calls for greater clarity on what the IGB's role in that is. I think I do have a better understanding now, particularly we've talked about the budget shifting to NHS Tayside, but Kate, again, you've been quite clear that the IGBs, plural, will have to have involvement in agreeing any strategies going forward and reviewing the implementation of that. But I would make that appeal and to the Chief Officer of this IGB as well, again, for further clarity to all members, voting and non-voting, on the IGB. I also think that there are some other options that we could perhaps look at. I'm never one for doing something on a Tayside-wide basis when it comes to the council, but I think that in this case, when mental health is being delivered across, as with other services across the whole of Tayside, that perhaps some kind of joint board with members from all IGBs on it might be helpful. I don't want to create an unnecessary burden in terms of additional governance, but that might lead to a better discussion, because we very rarely have any discussion with our colleagues on other IGBs, and given that this is something that's shared across the 3 local authorities, that might be an approach to consider going forward. And that also links to our own strategic planning group and possible changes to that. I'd like to see more IGB voting member involvement in that. I know that some non-voting members are involved. Not so that we are inappropriately involved in operational matters that we shouldn't be, but that so when we come to these meetings we have a better understanding of what's been discussed, even in an observer capacity, particularly in relation to mental health here, but that applies to all of the IGB's responsibilities. So I think with that, I would just say I'm very happy to agree to endorse the strategy, and thanks again to everyone who's been involved in creating it. Noting, of course, the question about financial implications, which we'll have to deal with through the budgetary process. But I'll hand back over to the chair. Thank you.
Thank you, Councillor Purvis, for these well-considered comments. Much appreciated. Councillor McDade is next.
Thank you, Chair, and I'll keep my comments fairly brief because I think Councillor Purvis has given a very eloquent summary for those of us that have watched the progress of mental health in Tayside over the last several years. I'm sure you'd agree, Councillor Drysdale. I think that I'd like to reinforce a couple of the points around. I think it would be good to get clarity on the role of Perth and Kinross IGB now, and I do think that a wider working relationship between the 3 IGBs across Tayside along with NHS Tayside on this matter, because it is so important to people across Perth and Kinross and Tayside, that closer collaboration would be beneficial. And I do recall a meeting, I think you would have been at it, Councillor Drysdale, a number of years ago in Nine Wells, where we did have representatives from all 3 IGBs to discuss this strategy, and it was a very productive meeting actually. And I think that something, even if it's joint briefings where we can actually discuss the issues that are affecting our respective areas and potential solutions, that is very helpful. I would actually just like to thank Kate Bell for all of her work. I mean, this is quite frankly a breath of fresh air for those of us that have perhaps been around for a while, and it's not an easy thing that you have taken on. I think the sort of open and collaborative way in which you have been working, and particularly with third sector groups, is very welcome, and an approach I hope will be taken on board in wider aspects of work. So thank you very much for that. And I think it, just as a final sort of point, it has taken a long time to get us to this point, a lot longer than it ever should have taken us. And I think it's right that we thank those in the third sector who have been working along with health colleagues to achieve this strategy. They have put in a huge amount of work, in many cases voluntary hours, to support the better delivery of mental health across Tayside, and they have rightly pushed to ensure that the best strategy possible comes out of it, and I think they should be thanked, and I think they can be very pleased with the result that they have achieved. That doesn't mean that we haven't got some more work to continue doing, but I think this is a very, very good starting point, and I just think that we should record our thanks for all of their efforts. So that's all I wanted to say.
Okay, thank you for your comments, Councillor McDade. I just offer one further opportunity for anyone else who wishes to add their own comments at this stage before I put the proposal to the board.
Chair, back on my just for a few seconds, just to acknowledge Councillor McDade's comments in terms of the third sector. I think in terms of taking the approach that we're taking to be open and transparent and inclusive has enabled all of us to be accountable to each other in the delivery of what you see as the final draft strategy for mental health and wellbeing in Tayside. And without that collaboration of all stakeholders, you don't get that attention and you don't get that outcome. I'd like to pay tribute to the stakeholder participation group who started out in the beginning of this, and some of whom I know I won't embarrass them by calling them out by name, are individuals that are members of the Perth and Kinross Integration Joint Board. And I have appreciated the challenge that they have brought to the table. And tonight there will be a meeting where the Mental Health Minister will give her thanks to the SPG in terms of their continued challenge to improving mental health and wellbeing services in Tayside. I'd just like to add to the Councillor's comments on my thanks to them for participating in this entire process, and indeed going forward in terms of their ambition to create a living experience network in Tayside by all partners. Thank you.
Thanks, Kate. That's appreciated. I just a further call for any comments at all from. Just as we speak, I see that Bernie has.
Thank you.
Sorry, bear with me. Bernie Campbell has just put a comment in the text, but for the record, Bernie, I wonder if you would just come on and make whatever comment you wish to make directly, so that it's recorded.
Thanks, Eric. Sorry about that. It's just to say that Maureen is obviously on and she can't comment, but she has sent me a text message to say that she wants to ask a question. So, I mean, I have got back to her to say, that's fine, tell me what it is, but you're about to say that you want to, I'm not sure if it's actually on this particular part, but if you're saying that you want to get everybody's agreement for it to go forward, I'm not sure at the moment if we need to wait for Maureen to get back to us. You'll need to tell me. Sorry.
Okay, well, it's a difficult one because obviously, as I indicated earlier, Kate has has yet to perfect the art of being in two places at the one time and needs to go to Angus IJB very shortly.
If I could say, in terms of Maureen sits on the mental health and Wellbeing Programme Board who met yesterday.
Sorry, I'm just going to interrupt because she's just sent me the message. So please excuse me while I try and read this out. She has put that that Councillor Purvis was told that there was a carer on the expert panel, and she wants to know who it is. And the document is just a document, but when our staffing level is going to be increased to deal with all the crisis in the community. Appears to, sadly, she's put that there's been lots of deaths in Tayside recently. Thank you.
Thanks, Bernie. Kate, are you able to come back on that at all?
So I guess, this is the discussion that we've all had, in relation to mental health as a public health priority in Scotland and has been taken forward as such in Tayside. We recognise the tragic nature of any suicide in Tayside as being a sad loss, and our thoughts go to any families who've lost people throughout that process. Maureen spoke passionately about that yesterday in terms of maybe making and pricing services, the day-to-day nature of the services, not necessarily the strategic planning aspect of this, but how do we respond sooner, better, easier for people who are in crisis and in distress. The strategy sets that out in detail. And Maureen, like many others, would be saying this is just a piece of paper. Well, we talked yesterday about the need to have a strategy in place that allows us to proactively do this and to make the changes sustainably over the piece. We are working with people in terms of the day-to-day nature of what Police Scotland do, what the Scottish Ambulance Service do, what the Health Service do, what our social work colleagues do in these circumstances. And as there is a multi-agency meeting being set up, if Evelyn or Gordon are able to speak to this from a Perth and Kinross perspective, to pick up on exactly what Maureen is saying today in relation to how do we work together to collaborate better to ensure that we reduce the number of deaths by suicide.
Okay, thank you very much, Kate. Can I just ask then, can you confirm, as Maureen has asked, who the carer on the expert panel is, please?
I don't have that information in front of me, I'm sorry, but I can email Maureen the answer to that. We can get Bill Nichol, who's leading on that piece of work, to send that person's name. If that's actually the right thing to do in terms of confidentiality, let me have a think about that in relation to, we wouldn't normally release individuals' names through email.
Okay, thank you. I think that Maureen was in the fact that Councillor Purvis had been told that there was a carer on the expert panel. So I think we just need confirmation that that absolutely is the case. Thank you.
I think we've written that down, that there absolutely is carer representation. So Councillor Purvis is right on that matter.
Thank you.
Okay, thank you. Unfortunate, Maureen has been unable to join us. I understand that the wrong technology was being used, and that has been the issue there. But we are where we are. We're at the end of this discussion now. So if there are no further comments, what I would ask is whether the board is agreeable to endorsing the strategy as proposed, and to provide approval subject to papers coming back in due course to outline the financial framework and seek the approval of the necessary financing through the various bodies, the local authorities, NHS Tayside, and the IJBs who may be involved in funding various elements of the strategy. So if I can ask if anyone opposes that, to make their views known just now, and otherwise we'll consider that to be agreed. Let's see. Councillor Duff, you have a comment?
Sorry, no, I'm happy to agree.
All right, the camera just come on at the wrong moment. That's fine. Okay, so that is therefore approved on that basis. So Kate, thank you so much to you, your colleagues and everybody involved in working towards this point, and I wish you well with the numerous other hurdles that you have to overcome in the coming days in order to get final approval of this strategy from the various other bodies. So thank you so much for your time today.
And thank you to the committee, and I look forward to all of us delivering the mental health and wellbeing strategy in Tayside. Thank you. Okay, thanks, and I'll let you get on your transporting device to Angus now. Okay, thank you very much for that, Chair. Thank you very much, IJB members. Speak soon. All the best. Okay, moving on to what was item 6.3 on the agenda, still is I suppose, which is the update on the redesign of substance use services and impact of COVID-19 in Perth and Kinross. And to give us a report, we are joined today by Claire Mailer, who is the chair of the local Alcohol and Drugs Partnership, and our colleague Laura Kerr, who is the ADP coordinator. So Claire, Laura, over to yourselves to present your paper.
Okay, hello, it's Kenny Ogilvie here to present. Claire Mailer is here as well, but unfortunately Laura couldn't make it today. So hello, it's Kenny Ogilvie, Service Manager with the Health and Social Care Partnership and Vice Chair of the ADP. Thanks, Kenny. Okay, thanks. I mean, obviously you've got the report. We have brought it today to update you on the redesign and implementation of the recovery-oriented system of care, and also the response of substance use services to the ongoing pandemic. Since the pandemic started, the number of referrals we've been receiving in our substance use services for support with drugs has remained fairly steady. However, the numbers of people requesting assistance for alcohol-related issues has increased significantly, and the second quarter of 2020 was actually the highest number we've ever received on record. And nationally, there is evidence that people are drinking more, with over 1 million adults reported drinking more since the pandemic begun. So obviously, if that trend is continued, that is a fairly significant cause for concern. In terms of the actual COVID response, there have been a number of changes to service delivery. For example, on the back of guidance from the Scottish Government, naloxone can now be distributed by non-specialist organisations. So we have implemented that in Perth and Kinross. The Drug Death Task Force for Scotland set out a number of recommendations and a self-assessment in terms of supporting people with drug issues during the pandemic. We have completed that self-assessment and implemented any recommendations as required, so we're now confident we are compliant with that. Scottish Health Action on Alcohol Problems did the same for folk requiring support with alcohol issues. And again, we carried out the self-assessment and made the recommended changes that are required. Most of them are about in relation to people still being able to access support during the pandemic. And again, as a rule of thumb, we're supporting folk virtually wherever possible, but we are offering face-to-face support, obviously on the basis of risk assessment as required. We have our multi-agency assessment clinic, which we've spoken about before at the IJB. That was held in Drumhar prior to the pandemic, and we had also started rolling that out to the rural areas. We had started having a clinic in Crieff and also in Blairgowrie. What we are doing now is we are holding that clinic virtually, and it's actually now happening on a daily basis, and people can access that through telephone, through Microsoft Teams, email, etc. And again, as I said before, we offer virtual support where necessary to get people into the system, but we can provide face-to-face support throughout Perth and Kinross as required. In terms of for people commencing opiate substitution therapy, we've reviewed the process for that and actually shortened the run-in time. It's now running at 1 to 5 days, but we're actively working to try and reduce that further. We've done fairly sort of practical changes, such as providing people with locked boxes for medications. They can store that in their house now rather than daily trips to the pharmacy. And we've also issued some people with mobile phones so they can keep in touch with services and also reduce the risk of social isolation. In terms of opiate substitution therapy delivery, many people with substance use issues have underlying health conditions. A lot of people were actually shielding at the start of the pandemic. A lot of people now still don't feel they can safely access their pharmacy. So we have worked together, statutory services and the third sector, to develop a service where we can actually deliver the medication to people's door, obviously dependent on risk assessment. And again, that is available throughout Perth and Kinross. Naloxone is now also available through the post, as is injecting equipment. And we also have fast-track COVID testing for people with substance use issues, and especially people living in hostels or people in prison are prioritised for that. As well as ongoing COVID response, we are funding third sector colleagues to provide ongoing monitoring of drug trends. In Perth and Kinross and throughout Tayside, there does seem to be a shift from opiates to stimulants. And obviously, if that shift continues, that could have a knock-on effect to our services. Our colleagues in Angus are currently trialling a stimulant pathway, so we're obviously keeping a close eye on that, and if that is successful, we could look at replicating that in Perth and Kinross next year. In terms of investment and service delivery, we were successful in obtaining funding from the Drug Deaths Task Force. And what we're doing in Perth and Kinross is we're using that to develop an assertive outreach service. And that's going to target people that have non-fatal overdoses. And we will be prioritising people that aren't currently known to substance use services in Perth and Kinross. We are also using some of that funding to develop mobile Buvidal clinics. That's a long-acting buprenorphine, which is injected. And again, as the clinic's mobile, again, that will be a service that will be available throughout Perth and Kinross. And again, the funding we have left is used to buy in motivational interviewing training, and that will be available to colleagues in education and children's services and also to substance use services. We submitted our annual report to the Scottish Government in October 2020. Again, that's on the appendix, it's the first appendix. I won't go through it in totality, but again, just to draw out some highlights, there are issues. We carried out a number of communications campaigns throughout the year, including Count 14, which is a reference to the recommended maximum intake of alcoholic units per week for adults. And we particularly targeted areas of deprivation and older men. Substance use is now embedded in the curriculum for schools as well. We have workers that go into schools regularly, and that's wrapped up in wider health and wellbeing discussions. In terms of alcohol brief interventions, unfortunately rates are declining in Perth and Kinross. That was a trend that existed before the pandemic, and that is actually a heat target. We still have high referral rates from primary care into our substance use services. So that's an indication that initial screening is taking place, and some of this may be down to a recording issue. But what we've done is we have identified funding to contribute to a Tayside-wide ABI coordinator post. So we're just waiting for confirmation with our colleagues in Dundee and Angus, and hope we'll get that post in place in the new year. And that can hopefully start to increase the rates of ABIs in Perth and Kinross. Prior to the pandemic, we had 8 recovery cafes up and running throughout Perth and Kinross, and we also invested in 2 peer support workers with third sector colleagues, Hillcrest Futures. Those workers actually helped develop the cafes in Aberfeldy, Pitlochry and Crieff, and on top of the cafes they've also set up hill walking groups, mindfulness groups, and they're also helping to develop the lived experience of reference group. Tayside Council for Alcohol have been funded to provide employment for people with lived experience, and that is paid employment, paid posts, and also volunteering opportunities. We have also funded a lived experience advocacy post with the Scottish Recovery Consortium. That post is now filled, and the person is receiving a lot of referrals, and certainly at the moment anyway, the majority of those referrals are for support for people with alcohol issues. We're also supporting the Active Life Skills Project. That's a joint project between the ADP, the Fire Brigade, St Johnstone Trust and West Bank, and that focuses on fitness and well-being, and it can also provide practical support to gain life skills such as diverse as SFA coaching badges to forklift training. We've also increased our capacity in the drug and alcohol team, so they're now able to run 2 weekly clinics at the hub in Perth Prison, and that's focusing people prior to the liberation. So hopefully there's a seamless service between substance use services for people in the prison, and then when they come back out to the community in Perth and Kinross, and that obviously is a time of very high risk for people coming out of prison. We've also funded a healthcare speciality doctor in the prison to support people with substance use issues. That post, we're still currently trying to fill it, but we have also funded advanced nurse practitioner posts, non-medical prescriber posts and support worker, healthcare worker posts in the prison, and they are now actually filled. We've funded transformation of men's services. That's a wraparound model for people in the criminal justice system to support them with any substance use issues or address any substance use issues. And also we have funded Tayside Council on Alcohol to have a post that can link in with the One Stop Women's Learning Service to provide substance use support there as well. As well as the annual report, in September we submitted our strategic delivery plan to the Scottish Government. That focused on the 4 national priorities of the national strategy, which is prevention and early intervention, recovery-oriented system of care, getting it right for children and families, and promoting public health approach to justice. In terms of the recovery-oriented system of care, nearly all of the developments I've just told you about are part of that system of care. And again, last time we came to the IGB, we showed you the pipeline diagram where we had all the services mapped out on that pathway. So again, we're continuing with that work, and we have held 1 meeting, and certainly once the pandemic has passed, we are intending holding quarterly meetings for everybody on that pipeline, just to make sure all the organisations, firstly, are aware that their organisations exist, what they actually do, how you can access them, and that will help people navigate along the pathway and hopefully ensure they're getting the correct support at the correct time. It's also a useful information tool for the public and for people from generic services as well, and we're currently working on a YouTube video to support that. We have agreed a performance framework so we can try and monitor the impact of the delivery plan. We have agreed key performance indicators. That framework is now up and running, and it's being monitored on a quarterly basis by the ADP strategy group. One of the key issues highlighted from the drug death task force was the issue of stigma. And again, there's a link to this in the report. It's the glossary of contested terms to try and address stigmatising language. And again, the ADP will be promoting that throughout 2021. Another key development is the integration of our statutory services. We've got the NHS Substance Misuse Service and the Perth and Kinross Council Drug and Alcohol team. So we're looking at integrating those 2 services to provide a more coordinated and effective support for people. So we will potentially be looking at integrated management structure, 1 referral system, joint documentation, etc. there. And I know the previous discussion was about the Tayside mental health strategy. That will also look at linking in and potentially forming wellbeing hubs in Perth and Kinross, and that will potentially provide people with support for mental health issues and substance use issues in a one-stop shop type of service. So again, we're working closely with our mental health colleagues, and Chris Lamont, who I believe has recently been at the IGB talking about the Perth and Kinross mental health strategy. He's now the portfolio lead for substance use and for mental health. We're reviewing and developing our non-fatal overdose pathway. mentioned the assertive outreach project which we will be developing. That will be a part of this. At the moment, we get information on non-fatal overdoses from the ambulance service and Police Scotland. They come into the substance use services via different means, so we're just reviewing that to make sure there's no delays in the information getting to where it needs to be. We're also looking at trying to tap into information from accident and emergency. If people are known to the substance use services, we make contact with them within 72 hours maximum. If they're not known to us, we're currently contacting them by letter or telephone. But once we've got the assertive outreach service in place, we will be able to actually go out and have the capacity to actually go and knock on people's doors and try and get face-to-face contact with people to try and offer support to them. In terms of governance, the Scottish Government issued the Partnership Delivery Framework in 2019, and that set out an expectation of strategic relations between the IGB, ADP and other community planning partners. What it doesn't give is the actual details of how that worked. So what we are suggesting is carrying out a mapping exercise just to work out how those various organisations or committees actually work in Perth and Kinross, and then just try and just work out the communication between the ADP, the IGB, the planning partnerships and integrated children's services. Because obviously addressing substance use it's far wider than just the specialist services. We really need to adopt, the whole system approach. So getting the communication links between those higher level committees is obviously essential for that. So just to sum up, we're basically asking the IGB today to note progress and continue to support the whole system approach to addressing substance use in Perth and Kinross. I'm now happy to take questions if people have any.
Thank you very much, Kenny. A very comprehensive report and a lot of information in there. I'll immediately lay it open for any questions from members. Councillor Duff, you have a couple of questions first of all.
Okay, thanks, Chair. Yeah, my first question is on section 2.2.1 of the report, which is on drug deaths, which states that ongoing challenges in terms of national toxicology services which predate COVID means it's not possible to give an accurate figure of drug deaths in Scotland. I'm a bit intrigued by that statement, and I wonder if it's possible to get any more detail about why that is the case, if it's technical or resources or financial or whatever.
I think it's lack of capacity to actually carry out the toxicology reports, and unfortunately there are months if not years delays in us actually getting drug deaths confirmed. I mean, again, we do record the number of suspected drug deaths, and again that does give us an indication of what is happening locally and allows us to take action, because obviously if we wait for the toxicology reports to come through, that could be months if not a year after the events, which is obviously far too late to try and then address certainly any trends that might be happening. I mean, this has been flagged up a number of times nationally. At the last Tayside-wide ADP meeting, the three chairs of the Tayside ADPs are writing to the Scottish Government just to raise this issue again. Like I say, we are fairly sure about our local intelligence and using the suspected drug deaths figures, but it would be better if we could reduce the time lag for the toxicology reports coming in.
Oh, okay, thanks. Yeah, I'm sure your own judgment in relation to these things is fairly accurate in terms of the eventual outcome, but it is perhaps a bit disappointing that it will take so long to get the thing confirmed. If I can ask my second question, Chair, are you happy?
If you just bear with me a moment, actually, Councillor Duff, I have Jackie Pepper and Pat Kilpatrick perhaps able to add to this particular discussion. Bring in Jackie first.
Okay.
Thank you, Chair. I was just going to ask Kenny just to give some reassurance to the board that where there is a concern that there's been a death as a result of a drugs death, that wouldn't prevent us from looking at that case, analysing any issues and learning from that, in the absence of that confirmation, and indeed I think we've got some recent examples of where that's been the case.
Yes, indeed. I mean, if there's a suspected drug death, we'll carry out review straight away. We don't wait for the toxicology report to come in, and obviously implement any actions that we learn from that review straight away.
Okay, thank you for that. And again, Pat, you'd like to come in as former chair of the Public Health Committee, and I know that the incoming chair, Mr. Benson, is obviously on the call as well, and he and I were on a public health meeting just yesterday, at which non-fatal overdoses, etc., were discussed. But perhaps you want to come in, Pat, with your comments on the toxicology issue.
Yeah, I mean, thank you, Chair, and thank you for a very interesting report, and it's really heartening to see all the really good work. And I don't suppose it was any surprise to anybody that alcohol misuse would go up during the pandemic, but especially in Scotland. But on the toxicology issue, I think it's an issue to do, as Kenny said, about capacity. I believe that Scottish Government, there's a contract with the University of Glasgow in terms of toxicology analysis, and we have raised, it was raised last year when the last drug death report came out, and I raised it several times with the chair and with the chief executive of NHS Tayside, and it has been raised with Scottish Government, and I think it's just an issue of how we can provide that service locally, and it's quite a complex service, and it doesn't see a huge number, so it's a difficult service to commission really, and I think there's only one specialist provider in Scotland. But Bob might know more than that, might have a more updated picture, but it has been a problem for some time, I know that. Thank you.
Okay. I don't know if Bob wants to come in at this point, but if not, if not,
no, it's okay. I'm happy with the responses given. I think I was thinking more about from a family perspective, if you like, about how long it would take to get the cause of death confirmed in that sense. Yeah. But okay, I'm happy to move on, Chair.
John.
Yeah, it was just on page 140, I think it is, in terms of the report that talks about representation on the ADP, and that it's not showing an NH board strategic planning representation on the ADP, and I just wondered if there was NHS representation, perhaps not at that level.
Don't know if you're able to answer that, Kenny.
I mean, certainly in the local strategy group there is NHS representation there, certainly in the form of the portfolio lead who I previously mentioned. We also have representation from public health in the strategy group.
Okay, thank you. Thank you. Bob, were you wanting to come in at this point with a comment on what we've been talking about?
Yes, please, Chair. For me, first of all, I think this is an excellent report, and I think the detail of it, particularly in the appendix area, and the link to the glossary of language, etc., is really informative in terms of that. And I think that glossary should be much more widely publicised. And I wonder if the Health and Social Care Partnership through website or elsewhere could maybe follow up on that glossary, because it's a very useful document about appropriate language round about drug users. So that's one point. You've started off the National Toxicology Service, which of course was where my first question was going to be, but it's been well covered by Councillor Duff and Pat Kilpatrick. The situation is unchanged for the reasons that have already been provided, but nevertheless, I think this issue should continue to be pursued. My second point is about this document is set around the impact of COVID itself, and we're now moving into a vaccination programme where we have some clarity around those who receive phase 1 vaccinations, but we're still unclear about who will be covered within the other phases of the vaccination. And I noticed that Gordon is touching upon that in some of his own officers' report as well. But I'm wondering, in the light of this paper, that we should perhaps, as a board, be giving more formal encouragement and support to the Chief Officer to raise this with Scottish Government about the vaccination priority for those substance users with underlying health conditions, and not least being health conditions, mental health conditions are a key part of this, and who are definitely at risk of severe illness or death. And I think we should encourage and support the Chief Officer to take this forward with Scottish Government, because I think it's an important issue. And given the death rate locally, then I think this is an issue that we really must push on. And I think it chimes in with the whole system thinking that we've just been talking about with mental health as well. One of the other elements within the report was, again, around thinking about whole system thinking, is that there was a section where there had been advances made to the licensing board around over-provision policy of alcohol, and this was rejected. It would be useful if we could get more traction on why that is the case, and to advance that case more directly through our Health and Social Care Partnership and other bodies who are involved in this, because it is a key issue about opportunity and easy availability, and I think it's an issue that worthy of maintaining pressure on it.
Thank you. Do you have any comments to make in reply, Kenny?
I mean, certainly in terms of the glossary, yes, we will be taking active steps to publicise and promote that in the very near future. In terms of the representation to the licensing board, I just need to double check that one. The plan was certainly to make a representation. I need to double check if it actually made it to the board.
Okay, thank you.
The document suggests that it was actually, must have been advanced if it was rejected. So I'm presuming that that outcome must have had an application.
Okay. I don't know, Claire, if you have any comments that you want to bring in here as well.
Yeah, I mean, I would say, I think in terms of the representation to the licensing board, I think, you know, the points that have been made there are well made, and certainly I think throughout this year our kind of challenges have been fairly obvious in terms of COVID response and COVID impact activity, but I certainly think that, you know, that is an issue that as an ADP strategically in terms of pressure and influence we need to pick up again, hopefully into next year. So I think, you know, we take that on board. That's a good point.
Okay, thank you. Councillor Purvis, and then followed
thank you, Chair.
Your question comment followed by Sandra Gourley. Thanks.
Yeah, and apologies, I would usually like to try and separate them out as much as possible, but it's quite difficult to be asked the questions I want to without giving the background, so I hope it's okay. Thank you for your presentation and for the reports that you've put forward. There's certainly some excellent work in there, and I agree with, although I might not agree with all of the contents of the glossary, I think that improving language around this issue is very important. I think I have a slightly different view than some of the other comments that I've made. I think that certainly in the report that you've put forward, I think that there is a lack of emphasis on recovery. So although we're talking about recovery orientated system of care, I don't see things like opiate substitute replacements or injection equipment provision as being something that is linked to recovery. My view is that that's supporting people to manage their substance misuse in a slightly more safe way. I also think in terms of the There isn't explicit mention of, although there's some mention of inpatient facilities, about rehabilitation beds, which is really important in terms of the pathway of care, and also about some of the more psychological interventions. Although the recovery cafe work I think is excellent, I think there is a lack of focus on what I would term as recovery. I know there will be different views on that. I also think in terms of the plan, some of the outcomes that we're trying to measure are perhaps not as detailed as I would like, or not as clear. So an example is about the multi-agency meetings that you're having. It doesn't say, are we wanting to have more of them because that's a positive thing in discussing with other partners, or do we want to have fewer because there are fewer cases to discuss, if you see what I mean? So I think that there's more work that needs to be done around that. But I think more generally, the comment part was that I personally don't agree with opiate substitute replacement therapy, and I've said that in the context of the prisons as well. I think that that's sometimes a missed opportunity where we give people a choice rather than actually trying to encourage positive changes in that environment. But I would like to see a greater focus on recovery rather than these what I would term as mitigation and management strategies of people who misuse substances. So just to get your comments on that, and also about the plan, how we could ensure that the outcomes are more measurable. Thanks.
Okay, thank you.
Okay, thanks for that. There was quite a lot there. Yeah, I mean, I agree totally. Opiate substitute therapy has its place, but it certainly is just part of the arsenal of supports and services that people require. And certainly with ADP, in terms of the funding we've had available, we have been trying to focus quite heavily on developing recovery communities in Perth and Kinross. We mentioned the 8 recovery cafes which were set up before the pandemic and are now operating virtually. We also have smart recovery available throughout Perth and Kinross as well, and that offers opportunities for employment and volunteering for people with lived experience. We are just in the process of renegotiating our contract with them, and instead of paying per smart recovery meeting, we're now going to pay a one-off payment, and we'll be able to get as many up and running as possible. And they've got a new local coordinator there who's come in with some new ideas. So we're hoping to continue to roll that out throughout Perth and Kinross. And as I said, the people with the lived experience that are employed by Hillcrest Futures, again, they are setting up numerous that try and focus on recovery, and again the importance of people with lived experience actually running these groups. And as I said, the numerous other developments that we fund through St Johnston's Trust in conjunction with West Bank, etc., that is all focused on the recovery side of things. I think that the aim is it's not just one size fits all. You know, different groups or different supports will appeal to different people, and it's trying to have as wide a variety out there that people can access throughout Perth and Kinross, and not just in Perth City, as possible with the resources that we have.
Okay, thank you. I'll come in.
In terms of psychological support, yes, there's been an issue with capacity in psychology services in Perth and Kinross for a while now. And again, that is another issue that the chairs of the ADPs are in discussion with our psychology colleagues. And we are looking, it's not just about having trained psychologists there, it's making sure you've got a trained up workforce that can provide that psychological interventions at a lower level for people, trauma-informed practice, and the likes of the motivational interviewing training that we're funding through the Drug Death Task Force monies.
Okay, thank you for that, Kenny. You okay with that, Callum?
Thank you. Yes, and Chair, if I could just very briefly add, you know, I don't intend to bring an amendment. I know there are clearly going to be differences of opinion on some of the issues here. What I would ask is that, and I note that Pat Kilpatrick also raised the issue about the pathway from substance misuse and mental health in the previous discussion, that perhaps at a future meeting, if you're content and other members are content, to maybe come back and give us more detail on, particularly on the mental health side, but also some of the other recovery measures rather than those mitigation things. I know it might be a factor in that, but that pathway that we could all consider and get greater assurance on the measures that are being put in place going forward, if that's possible.
Yeah. Okay. Thank you. Okay. A further final question from Sandra Gourley.
Thank you, Chair. Just a question of clarity, really. That's around section 2.2.6 around the delivery of medicines. And just wanting clarity to just make sure that there has been pharmacy approval around all of that process in terms of governance. And excuse me for not knowing. I'm happy to take it offline if you think it more appropriate as well. And the second part of that was around the key performance indicators at the end. I'm just wondering if they're quite quantitative, if you like, and I'm just wondering if there's any plans to have more kind of lived experience of story type indicators that would reflect that person-centred type approach.
Thanks, Sandra. First of all, in terms of the delivery for medication, yes, pharmacy were right through the centre of that. It actually took quite a while to develop the operating procedures because, like I say, we had it was joint working between a third sector organisation and statutory services, so it was a little bit more complicated than just writing them for statutory services. But no, pharmacy were right the way through. It was all signed off and deemed to be safe before we actually implemented that.
Thank you. I assume that. Thank you.
In terms of the outcome measures, we've been waiting for the national database for substance use, DAISY. Its implementation has been delayed for quite a while. I believe it is actually up and running in a number of areas, trial areas in Scotland now, and hopefully by the start of next financial year that will actually be operating in Perth and Kinross. And part of that DAISY system is an outcomes tool as well. It was going to be the Recovery Outcomes Web. I think it might now be a different one. But again, that performance framework and outcomes tool will give us some more personalised outcomes that are missing from the current performance framework. Like I say, we didn't want to go and implement that in Perth and Kinross and then get a national decision made and then go and have to change it. So we'll be a wee bit delayed in that, but hopefully, like I say, by next April, that should be up and running in Perth and Kinross.
Okay, thank you for that. So I'm not seeing any more questions or comments in the chat, but if there are any more comments, please indicate that you want to make them now. And if nothing comes up in the next few seconds, so no more comments. So we are being asked to note the progress of the PKADP as noted within the annual report and the strategic delivery plan, and to continue to promote a whole system approach towards service design and delivery. And if we can agree these recommendations and reflect on and incorporate the comments made by Councillor Purvis and look for a further report at the appropriate time in 2021 on the issues that he raised. So are we agreed on that? I shall take silence as approval. Okay, that's great. That's agreed. Thank you for that. Okay, as indicated at the start, I'm now looking to take a short comfort break. So this meeting will go into recess and we will start back at 3:15 prompt. Thank you. Okay, thank you everyone. If we can now resume the meeting. I hope we've managed to stretch our legs, albeit briefly. And we shall now move on to item 7 on the agenda, which is the Chief Officer update. So Gordon, over to you. Thank you.
Thank you very much, Chair. Hopefully colleagues will have had the opportunity to read the report that I've prepared today, which is admittedly a short report, which reflects the fact that we've got a very busy agenda, but seeks to focus on 3 main areas in relation to the activities that the Health and Social Care Partnership are progressing in the context of the COVID-19 pandemic. The first area that I've covered here is around flu immunisation, and I would just want to draw the IJB's attention to the fact that we have embarked upon a very ambitious programme of the delivery of flu immunisation over the last 2 or 3 months, and this report gives an indication of how we have sought to do so and of some of the progress that we've made therein. As the Chair said from the outset of this meeting, we do have further clinics planned for the delivery of vaccinations over this weekend, and we would certainly encourage people to take up those vaccinations, because the flu immunisation programme is one part of a extensive and thankfully growing weaponry against COVID-19. The lead in relation to the flu immunisation programme and COVID vaccinations, which I'll go on to discuss in a minute, is with us today. That's our primary care service manager, Lorna Jackson-Hall. So members may well have some questions in that regard that we can bring Lorna in to consider. If I could move on to flu immunisation, and move on from flu immunisation to talk about the COVID vaccination programme. Members of the IJB will be aware that Perth and Kinross, as a council area, is in Tier 3 in the context of the Scottish Government strategic framework. And this time yesterday, the Cabinet Secretary announced that that would continue to be the case. This reflects the fact that there are still a relatively high number of cases emerging in Perth and Kinross, albeit what we have seen over the last week is case numbers and test positivity has consistently decreased. So we are seeing a decreasing number. The trajectory is encouraging. We just really need to ensure that we're achieving a degree of pace and traction in that regard in all that we do. It's also the case, and members will be interested to hear this, that hospital admissions across Tayside in relation to COVID have remained fairly static over the last 3 weeks or so. At any point, there are perhaps around 60 people in Ninewells with COVID, although obviously that number fluctuates. And what we're seeing are single figure numbers consistently of patients in ICU or HDU. So that provides a bit of a backdrop to the COVID vaccination information that I would wish to share to you, building on what has already been indicated by the Chair earlier today. We are obviously delighted that the Pfizer vaccine has passed the necessary tests and has become available for use. We had been working on a programme along with colleagues in NHS Tayside who are leading on this, around the prioritisation, the logistics, the delivery, the workforce, in order to initially provide vaccines to key groups of healthcare staff from a central point at Ninewells until Last week, when the Cabinet Secretary announced that it had been determined that the vaccine was more portable and stable when transported than had hitherto been thought to be the case, and her expectation would be that we would therefore then be in a position to deliver the vaccines more swiftly than was otherwise the case to care home residents and staff. So while the first vaccines have been administered this week in Ninewells to healthcare workers, the plans that are being revisited will take us to a position where from the 14th of December we will be in a position to begin that programme of vaccination. So the plans are in place. There are the workforce is in place. NHS Tayside have been able to secure the services of returning retirees, and they have been trained up in order to deliver the vaccine, as well as existing staff who've been identified as vaccinators. And as the plans develop, the numbers of vaccinators will increase as things progress. We within Perth and Kinross Health and Social Care Partnership have, as I say, identified key leads in relation to the delivery of the vaccination programme, and we've put in place a command structure that is led by Evelyn Devine, our Head of Health, and Hamish Dougal, Associate Medical Director, in terms of sort of gold, silver, bronze command structure to consider the planning, the preparation and the delivery of the vaccine, but also to then escalate any unresolved issues or challenges that might emerge to the Gold Command within Health and Social Care Partnership. So the third item that I would reference, and thereafter obviously we can take questions, and I may bring Lorna Jackson-Hall in relation to flu and COVID vaccination, and perhaps Diane Fraser in relation to this third item, which is about care homes. We're continuing to provide very robust and active support to independent sector and local authority care homes across Perth and Kinross, recognising the vulnerability of residents and based on our earlier experience when we saw some outbreaks in care homes. This is led by a team within the Health and Social Care Partnership. We have daily safety huddles. We have a RAG rating in respect of each of the care homes, and we have ongoing engagement and involvement with the sector, supported by the Scottish Care Integration lead Lynn Blair, who's a member of the IGB, which includes regular Zoom calls with the providers, and on an ongoing basis, the provision of best practice advice in relation to infection prevention and control, any updates coming from the government in relation to the delivery of visiting, and we continue to see high numbers of staff being tested each week in the care homes across Perth and Kinross. Similarly, we have access and supported homes to gain access to PPE, and where staffing situations arise, we are able to advise and sometimes provide some support in that regard. So we're continuing to work very effectively and very hard and intensively in those areas. Important perhaps to note, however, that doesn't sometimes preclude outbreaks from emerging, and we have had the situation recently where we have had some COVID outbreaks in care homes. In response, we have a very effective outbreak management plan that involves public health colleagues and input from infection prevention control. We work closely in this regard with the Care Inspectorate and Healthcare Improvement Scotland, and we are taking a very much improvement focused and collaborative approach with the care home sector in Perth and Kinross as we collectively try to combat the challenges that COVID is bringing. A couple of other points is probably just to note that the intention to bring in testing for visitors to care homes. There are a number of care homes in Scotland that are currently piloting a model that will enable this to be rolled out in the new year, and obviously we will be very actively involved in supporting that in order that we can mitigate any risk of transmission from visitors coming into the care home, and most importantly ensure that people who have not been able to visit loved ones are better able to do so more routinely as we move forward. So Chair, I'll probably stop there and invite any questions or elaborate if there's anything that members of the IJB would wish me to do so. Thank you.
Okay, thank you very much, Gordon. There will be undoubtedly some questions, and first up is Councillor Purvis.
Thank you, Chair. It was just on the vaccine rollout, and clearly it is very important that we all get vaccinated, as that's the route out of this situation. So this question is not to draw any concerns, but it's just given the press coverage today in the Courier, I think, about 2 medical staff in NHS Tayside who had an allergic reaction, which of course is not uncommon in some vaccines. I'm just wondering, does that affect our rollout plan for the vaccine, given that new advice that's now been issued following that?
Thank you, Councillor Purvis. I had anticipated that if this wasn't raised, I would take the time to provide some information in this regard, and this is the consequence of the vaccine resulting in two health workers suffering anaphylactoid reactions. It's reassuring to note that those were mild, and it's important to note that these were people who have a history of serious allergies and actively use adrenaline pens, as a consequence of which I gather that revised guidance is about to be issued by the 4 nations chief medical officers, and that will inform the need for particular caution in the circumstances that I've described, and possibly also some exemptions and some reclassification of how and to whom the vaccine should be prioritised. So this is an unfortunate development that I've seen trailed in the news, and I've had email correspondence about in the course of today. And I suppose we should be reassured that the concerns that have arisen are leading to improved learning, and guidance will reflect that, and we should see that guidance mitigating this from being something that occurs with any frequency in future.
Thank you.
Thank you. And I notice Lorna Jackson Hall is wanting to contribute at this point as well. Lorna?
No, just to reiterate what Gordon's just said, it was just to support that information coming through today.
Okay, thank you. Thank you.
Sorry, Chair, is it possible to ask a second question, or I can come back if you want?
No, just go ahead. Thank you. I'm getting confused with my mute microphone and stuff at the moment. Sorry.
Thank you. It was about testing of care at home staff, which Chief Officer we've discussed on a number of occasions in different fora, and I've made the point that I think it's really important that we try to roll that out to as many of the care at home staff as we have. I know the guidance has been changing and developing on that issue. I note that in Glasgow, they now seem to have rolled out 100% testing of care at home staff. I'm just wondering, have you heard about any learning from that, and also whether, again, if that is something that we could consider in this remaining months until the vaccine is fully rolled out in Perth and Kinross? Thanks.
Thank you. No, I wasn't aware of that having been something that's been achieved in relation to care at home staff. Certainly the public health advice here is that would not be something that would necessarily be able to be prioritised at the moment, and that's a combination of both capacity and technology. It's also a consequence of the fact that the levels of risk that have been assessed in relation to care at home staff are less than perhaps in hospital wards and care homes, where people might be spending several hours in the company of someone who could be infected and asymptomatic. When I say technology, I think some of the challenges there are around the volume of testing that would need to be done and the capacity that would be able to be delivered in order to secure reliable routine tests to a further workforce of several thousand across the country. However, the indications from the Scottish Government are that they are reprioritising, or sorry, that they are addressing some of the technological and capacity issues by the introduction imminently of volume lateral flow testing. And these are tests where the test result can be given within a very short window. There is an intention that this becomes something that's available this side of Christmas to large numbers of NHS staff and healthcare workers, in anticipation that this will then become available in the new year to further cohorts of staff, including social care staff who provide care at home, and also potentially to teaching staff, in order that they can be supported to be tested, and for people who are asymptomatic to be able to be self-isolate and avoid any cross-infection. So I think that's probably as up-to-date a position as I have on it, Councillor Purvis. It will become more available as these technologies and that capacity develops over the coming weeks.
Okay, thank you. Well, I've made the point before, and I won't dwell on it. I just think that going into multiple people's homes, there is a risk to the people who are receiving the care services, which is why I'd like to see it, at least as a precautionary measure, increased. But I'll send you the information about the story that was in the Glasgow Evening Times. Thanks.
Thank you. I mean, I could just add that there are several numbers of precautionary measures that care at home staff would take before they visited and then visited other people in their own homes. And you know, there's the robust use of PPE, infection prevention and control advice. So testing would be absolutely one part of that, and we will look forward to seeing how that develops over the next month or so.
Okay, thank you. And if there, I'm not seeing any more questions. If there are any further questions before I come to comments, I have my hand up here. I have my hand up here. Sorry, I'm not seeing who that is.
It's Bob Benson.
Oh, sorry, Bob, you're not on my screen. On you go, Bob.
Thank you. Thanks very much, Gordon, for the update, and I think we appreciate all of the work that you're doing under very trying and challenging conditions for you and the whole staff team. At some point, it would be really helpful to have some kind of pulse check on the health and well-being of the staff as we're going through this work. I know that you probably say, well, we're doing this all the time, but given that the emergency powers are likely to be around until the end of March, and who knows, they could be extended, it would be helpful if you could just make some statement on how we're looking after staff throughout this period. But coming back to the paper itself, flu vaccination itself, could you apprise me of, initially I heard anecdotally that there were issues around about the communication of the best ways to get access to the vaccination for those who were in the criteria groups that were there. Did we have a problem in Perth and Kinross around about this? Because I know there may have been website issues, and also some of the letter correspondence wasn't necessarily as clear as it might have been. Now, given that a lot of the learning from that will have been incorporated into now a COVID vaccine, are we absolutely assured that the early information will be absolutely right for this next enormous vaccination program? And one other point on the flu vaccine is that we know that NHS staff have free access to the flu vaccine. Can you tell me what is the position for social care staff, given that they are also working in close proximity with vulnerable individuals and groups? And if there has been any programme, do we know what the kind of take-up has been?
Thanks, Bob. Chair, I'd probably bring in Lorna Jackson-Hall at this point. I see that she's put her camera on, and we'll have more up-to-date information in relation to both those points. Can I just firstly talk about the health and well-being of staff, because absolutely this is key, and this is something that we have been sensitive to. I think we're in, the 250th day of our COVID response, when we maybe thought from the outset it would be a sprint rather than the marathon it's become. If we have everything else in place, a command structure, a workforce matching unit, supplies of vaccines, etc., all that fails if we don't have resilient staff. All that fails if we don't have staff who we've looked after and who feel supported and connected and rested. We are very aware of that and highly attentive to it. We are bringing forward a range of actions that seek to support the health and well-being of staff, including some support from our statutory partners, organisational development colleagues, as well as looking at whether or not we might outsource some support. We're very keen that we adapt to this new way of working, and that it enables people to be rested and connected. So there's various pieces of advice and guidance being offered to staff. And we will continue to do that, because we do recognise that that is a critical issue as we move into the Christmas period and into the new year. Moving on to the flu and COVID vaccinations, it's probably worth saying before I pass to Lorna, I know that she's waiting to come in, that the success and effectiveness of flu immunisation and ultimately thereafter of COVID vaccination will be greatly enhanced by the contribution of primary care by our GP colleagues and by practice nurses and by a wide range of colleagues who are stepping forward to provide support. And we've seen benefits from that in terms of flu immunisation that we will look to take into our COVID vaccination response as well. But Lorna, if I could hand over to you to provide a bit more detail, please.
Yes, thank you, Gordon. This is the first year that social care staff have been included in the flu vaccination programme, and NHS Tayside Public Health took the central role in this, with myself leading the patients, and we had a senior nurse leading the health and care social staff when we were both linked into the NHS Tayside Public Health vaccination group. There were 3 ways that staff could care staff could access the flu vaccine. One was within a care home situation if they worked there whilst the patients were being vaccinated. There were health and social care clinics which were advertised with posters, and also there was a community pharmacy route as well. Now, I appreciate there was some issues around the community pharmacy. These letters were sent to staff. Not all staff particularly just seemed to receive them, and we did try to put them out through all the different routes, and I linked to the care home group through Lynn Blair and Lindsay Bailey with weekly updates through our Silver P&K command. When we realised that there were issues at the community pharmacists not accepting care home staff coming with their badge in the letter, this was escalated back up to NHS Public Health and linked to the community pharmacy lead to escalate this issue. And in fact, I personally rang a few community pharmacists to sort out some of the issues escalated to me by Lynn Blair. At the beginning of November, we did have a national shortage of vaccines, but this was resolved within about 2 weeks. And so there are appointments available still at community pharmacies for care staff, and in fact we still got some partnership clinics this weekend which can be accessed via GPs, and some of the GP practices are still running clinics, particularly for the 60 to 64-year-old cohort. I have some hot off the press update figures for you, but not for P&K particularly, because they're not available from Public Health that I got this afternoon. But at the moment, non-NHS staff, which is quite a big wide group, I guess, is sitting at 18.2%. There's no comparable figures for last year because we never did it last year, and we still await to find out if care staff would be included in next year's flu vaccination programme. Amongst NHS staff, it was about 60% across NHS Tayside, and I don't have the granular figures yet. Those are still being updated, those figures, so there's still some information coming in from community pharmacies to update those figures. So those will be probably available from Public Health towards the end of the year. Does that include all the comments you were asking me about?
That's Lorna,
yeah, thank you.
Jackie Pepper was looking to come in as well.
Thank you very much, Councillor Drysdale. My comment was about the check on how staff are doing, but also just to advise the IGB of a bit more detail around how the council, as one of the partners that Gordon was mentioning earlier, is working to support our COVID response. And we've had across the council 261 staff who've come forward as volunteers for as COVID responders, and a smaller proportion of those are willing to work in social care and take on some of the roles there. However, what we're trying to do is, in terms of our management of that, along with in partnership with health and social care staff, is to find a way in which we can assist, backfill, bring in expertise in across all areas such as project management, in any way that we can assist to allow staff to have a bit of downtime, a bit of rest and recuperation, because I think we recognise that it's the same staff that have been in the front line since March, and that there is quite a bit of fatigue around that. So it's just really to give some reassurance that we are trying to problem solve across different services with in the council to bring that expertise into health and social care where we can.
Okay, thank you, Lorna and Jackie. Bob, has that answered your questions?
It has done, because obviously the issues about staff absences are really quite critical at the moment. So that's an important area that we've been apprised of. Thank you for that. Just, it would be helpful, Gordon, at some stage, not today necessarily, but perhaps if you could drop a note around about the terms gold, silver, bronze command, and because they're used quite liberally, and actually quite a lot of people don't fully know what they mean, and it would be really helpful if that could be clarified, but not today.
Okay, thank you. Thanks for that. And I think if there are no further questions, which are none on the chat, Sandra Auld, I think you have a comment to make.
Yes, thank you, Chair. I just thought it would be worthwhile mentioning that there are, as well as the vaccines that have already been made available, Tayside's leading UK programme of ongoing research for COVID vaccines. So there's an opportunity for people to participate in that and support the ongoing development of other vaccines. I think there's perhaps a concern that everyone might think that the vaccine situation is done and dusted now that the AstraZeneca and Oxford and the Pfizer vaccine are made available, but we still need ongoing development. So there's an opportunity to support in Tayside with the work that's going on there.
Okay. Thank you very much for these comments, and thank you, Gordon, for your report. Okay, moving on swiftly. So we're back up to the Audit and Performance Committee report now, which was item 6.1, moved to accommodate the mental health discussion earlier. So can I ask the Chair, Councillor Purvis, to give a verbal update to the committee? Thank you. To the board, thank you.
Thank you, Chair. I'll try to keep it reasonably brief because I know we still have quite a bit to get through. We discussed a number of issues at the most recent committee, including on the audit recommendations, where there are still a number of outstanding issues that need to be progressed, including on the risk sharing agreement and some of the other governance points that had been raised. There was also an action which the Chief Officer has implemented for him to write on my behalf to the Chief Executives of both the Council in Perth and Kinross and NHS Tayside to tell them that consistency of membership within the IGB is very important, given some of the recommendations that we've had in inspections, while noting that that is, of course, a matter for the Council and the NHS Tayside Board to determine. We did raise some concerns about the progress on internal audit, which might be somewhat delayed in terms of getting reports to us. This is because some of the staff there have been redeployed. I raised some of my own concerns about that, particularly given some of the quick working that has been necessary during the pandemic, which needs to have appropriate scrutiny of it. But the Chief Internal Auditor ensured us that she felt able to continue to discharge her responsibilities with her team. We also agreed in principle to adopt a new set of internal audit common definitions. There were some concerns raised by Ronnie Erskine in particular about whether the NHS are looking to adopt this common set of definitions for internal audit reports that are being adopted by other public sector organisations, and given the integrated nature of what we're doing, that it wouldn't make sense for the IGB to adopt something as a common set of definitions if NHS are not doing the same. So we agreed in principle, but asked the Chief Internal Auditor to go back and check with our NHS colleagues whether that was something that they were going to do or indeed were willing to do. We had an update on the strategic risk management and the risk register. We now had a high level combined risk register with our existing strategic risks and also the COVID-19 risks. We got an indication of how those had been pulled together. This is something that we had asked for at previous committees because we think it's important. While there's certainly been positive news, as we've been talking about the vaccines, we need to make sure that we combine the risks that the emergency response to the COVID-19 pandemic has on our other existing strategic priorities and strategic risks. We didn't get the full version of that at this committee, primarily due to resourcing issues, but we hope to have that at our committee in February for scrutiny. We also had an update on the joint inspection and the implementation of that. And there were some positive signs in the progress that's been made on that, noting again the delays that have resulted because of the emergency response to the pandemic. And we also had notification of our external audit appointment, which was just for noting that had been extended for a year, and it was not something for the committee itself to determine. In terms of performance, I won't talk about the financial position, given that we have a similar report to the committee, to the IGB today, which we'll also be discussing. We had a report from the Chief Social Work Officer and the Associate Medical Director about the Care and Professional Governance Forum, which I think was a really useful oversight of the work that they do. We still have to determine exactly how we're going to implement assurance and governance on clinical care and professional governance at the Integration Joint Board, whether that's through a committee or to the board itself. But it was useful to have that assurance to the committee, and there were a lot of positive outcomes that we could see within that report. We had a rather large performance report, again due to the pressures of the pandemic. We weren't able to have that at the regular 3 months intervals that we would have usually liked. So this is a report for the 6 months to the end of September 2020. Again, there was a lot of positive news in that, and some of the national indicators, there was good signs on that too. But there were some areas that we need to look to improve on. In relation to hosted services, which is something that we had asked for information to come more regularly to the IGB, and in particular the Audit and Performance Committee. While there was an overview of local hosted services, we are looking to have, as part of future reports, information on performance in relation to hosted services that are hosted at other IGBs, so in Angus and in the City of Dundee, given that they are providing services on our behalf. But that also means that we need to make sure that performance data on the services that we provide is passed to the appropriate IGBs there. And we talked a little bit earlier about some of the ways we could collaborate across Tayside, and again, that was a discussion that came up at the Audit and Performance Committee. Finally, in terms of the substantive agenda, we had an update from Lindsay Bailey the locality manager for South Perthshire and Kenosha, about some of the work that she and her team were doing. This is part of our rolling programme that we've asked officers to give presentations to us on how we deliver our services to meet our strategic objectives on the ground. I think that's really important. We're a service-based organisation, and we want to see how that's being done at a very local level. Clearly, we had a lot of information on the COVID-19 pandemic, because the most recent period, that's been a big feature of the services that we've been delivering. But I think particularly in South Perthshire and Kinross, there's been a heavy emphasis on community work, so working with local action partnerships and also other community organisations to involve them in service delivery and also help them determine and set the priorities within the parameters of the strategic plan that we set out for the whole of Perth and Kinross. So I think that was really useful, and we've had one for the North locality as well, and I hope we'll be able to get a presentation for the Perth City locality in the near future. So that was it. As always, the papers are available on the council website, and there's an ongoing open invitation to all members of the IGB, voting and non-voting, who are not on the Audit and Performance Committee to attend. Our next meeting is at 9:30 on the 15th of February, and committee services will invite you to that again, and I would be very happy to see as many of you there as possible. Thanks.
Thank you very much, Callum, and can I just thank yourself and your committee for some very robust scrutiny of important issues to us all, and it is much appreciated, I'm sure, by the rest of the board. If I can just ask if there are any questions to Callum at this point. Don't appear to be, or any comments? Don't appear to be. Okay, thank you, Callum. That must have been a really thorough report, because there's no questions and no comments. So thank you very much indeed. Conscious as always of the time, we shall now move on to the current financial position and the budget and the 2021-22 budget. So first of all, item 8.1 on the agenda, the 2020-21 financial position, and if I can just ask Chief Financial Officer Jane Smith to come in with her update, please. Conscious that this has already been covered to some extent in development session, but obviously it's also important that this is set out in public as well. So thank you, Jane.
Thank you, Chair. The full report has been circulated, and hopefully members have had a chance to digest that. However, I would recognise the increasing complexity of our financial forecast as we continue to try to differentiate between our core position and the impact of COVID on our position. We continue to respond to evolving Scottish Government guidance in this respect, and I would acknowledge the complexity that brings to our report, and I'm very happy to take questions where there is a need for further clarity. So just very briefly, in terms of our core position, at month 4, the last report that we brought to the IGB, we reported a core operational overspend of 0.7 million, and that has moved significantly to an underspend.
Jane, can I just interject at this point in time, and apologies to you for this, but I just note in the chat there that Diane Fraser is about to leave the meeting to attend another meeting. Diane, if you're still there, I wonder if you would mind coming on camera briefly. Or is she gone already?
That would be a shame.
She may well have left very quickly after posting that message.
Right. If I can just explain, and apologies again, Jane, to you for intervening, but I'll say it now so that it is a matter of public record that Diane Fraser is leaving us. This is her last IJB, and she's gone. She has been appointed to a head of service post in North Lanarkshire, which she starts at the end of January. So Diane has worked for 14 years for Perth and Kinross Council, and latterly in the Health and Social Care Partnership, and she has been a very important and influential member of the team throughout that period. Gordon has asked that we recognise, and I would join with him in this, recognise Diane's calm, reflective and considered approach and a strong value base. And on behalf of the IJB, I would like to thank her for the commitment she has demonstrated to improving services and outcomes for service users and carers, and to wish her all the best for the future. So, and Diane, what I'll say to you is, because I'll ask Gordon to get her to view this recording of this particular moment, which is some 3 hours into, or just short of 3 hours into today's meeting, just to view this, to say thank you to you for your service, and to wish you all the best for your future career. And I'm sure Gordon and others will join with me in that. I don't know if you want to add anything briefly, Gordon, yourself.
Thanks, Chair. No, I mean, it's unfortunate that Diane was quick off the mark when she needed to go to another meeting. I will certainly convey those comments. I'm grateful for them from you, and would add to them my own sincere thanks to Diane for all the work that she's done. She'll be a sadly missed member of the AMT, and she's been very supportive of me since I came into role. So we recognise that she goes with a heavy heart, because she's got a strong commitment and legacy here. But absolutely, we support her and wish her all the best in her future career in pastures new. So yeah, we will make sure that we force her to watch this part of the IJB. Absolutely. Or maybe the technology could edit this part out and we could send it on to her.
Absolutely. Good stuff. Okay, thank you for that, and Jane, apologies to you for interjecting so abruptly like that when you were in full flow. So back over to you.
Not at all, Chair. I understand completely. Just to recap, we are seeing a significant improvement reported at month 6 in terms of our underlying position. The key drivers of that are in relation to expenditure that was previously being offset to COVID expenditure now being reported in the core position, and that accounts for £0.7 million of improvement in the core position. In parallel, in relation to Angus and Dundee hosted services COVID costs, these were previously reported in the core position and have now been moved appropriately to be reported as part of the COVID position. So those two things are not fundamentally changes in our overall position, but a change of about 1.1 million between what we are reporting as core and what we're reporting as COVID, bringing an improvement to the core position, and in line with Scottish Government guidance in that respect. In addition to that, in terms of the core position, there are a number of services that are reporting increased levels of vacancies, which is benefiting the financial forecast. And finally, we're reporting an improvement of around about 0.2 million in relation to the prescribing position, again supporting that overall improvement in the core position from month 4. It's important to note that the £1.2 million forecast underspend that we're talking about on the core position today excludes slippage on savings delivery, and that's sitting at 1.3 million and is sitting within COVID forecast expenditure later on in the report. Most recent Scottish Government guidance indicates that savings slippage will not be funded and will require to be managed by Health and Social Care Partnerships and NHS boards as part of their core operational position. And for Perth and Kinross Health and Social Care Partnership, the operational underspend of 1.2 million, which I've just described, is almost sufficient to cover that £1.3 million slippage in savings. And I can advise that, having just signed off the month 7 position, the forecast operational underspend is now absolutely sufficient to cover the slippage in savings that we're reporting, and therefore we will be able to forecast a break-even position on the core position once we bring savings over to that. So that's good news from a core position perspective. In relation to the financial impact of COVID, there is an increase in forecast expenditure reported from month 4 to this month. It's increased from 7 million to 7.9 million, largely driven by the hosted services expenditure that I've just described, and we have got some additional staff costs now forecast. Further Scottish Government income, however, has now been confirmed, and the COVID-related gap has reduced to £1.9 million. However, of that, 1.3 million relates to the savings slippage that I've just described, which will be removed and will be able to be absorbed by the underspend in our core position. That leaves a gap of 0.6 million, and we've had full confirmation from the Scottish Government that further additional budget will be released in January that will cover that in full. Therefore, in conclusion, there is a positive financial position to be noted by the IJB today, with break-even likely to be achieved across both our core and COVID positions, and therefore overall. The key risks to that are ongoing fluctuations in prescribing expenditure, which is an ongoing risk year on year, and we will keep the IJB updated in that respect. Happy to take questions.
Thank you, Jane, and I'm good to. I wish I could record myself saying this. A positive financial report, you know, for the first time in quite some time. So thank you again to yourself and your team for your efforts to bring that about. Are there any questions for Jane on the current financial position? And Ronnie Erskine, I'll ask you to come in. Thank you.
Thanks, Chair, and thanks, Jane. Just before I go, I just wanted to say it looks like a good overall position. It's a welcome report, I think, although there's still, I guess, 3 months to go to the end of the year. The one question I had related to the costs of the COVID vaccine. I wondered if they were included in. Do we have any sort of projection or estimate of what they might be, and have we got an assurance that they will be fully covered by the Scottish Government? Thanks.
Thank you, Ronnie. It's a very pertinent question in the circumstances. We are working closely with senior finance colleagues to understand the COVID vaccination costs. They are largely likely to be picked up by NHS Tayside in terms of how the vaccination programme is being run. But we have a strong commitment from the Scottish Government, as we've had in relation to all other COVID expenditure, that there will be full funding for the vaccination rollout.
Thanks, Jane. That's great. Thank you.
Thank you, Ronnie. And I know you've got to go now, so thanks for your contributions this afternoon. Are there any further questions or comments? No. Okay, thank you again, Jane, for that report. And if you'd like to now move on to the budget situation. Thank you, Chair.
Again, a report has been circulated, and I'm assuming that members will have had a chance to read it. The first thing to note is that the partnership team fully understand and recognise the importance of medium-term financial planning in delivering sustainable services. And the 3-year financial recovery plan approved by the IJB in March 2020 established what we hoped would be a best practice long-term approach to longer-term financial planning in the partnership, and that move was endorsed positively by external audit. Unfortunately, the COVID-19 pandemic not only severely curtails the capacity of heads of service to engage effectively in long-term planning, but also requires us to much more fundamentally consider the shape of future services that lock in the service improvements that have been made as part of COVID response for the longer term. and therefore as an extraordinary but pragmatic response, a one-year 21-22 budget will be brought forward to the IGB for approval in March 21. This paper summarises the work to date to update the provisional budget. It also outlines the further work that's being undertaken to set out the non-recurring pressures and opportunities that will impact in 21-22, and these will also be included in the budget to be brought forward in March. Happy to take questions.
Thanks very much again, Jane. And again, I'll ask if there are any questions to the Chief Financial Officer. As I say, we have discussed this in development session just very recently, so I imagine a number of questions have already been answered, but if there are any further ones, please indicate now. Or any comments. Okay, thank you again, Jane, for your report. That's brought us nicely up to date, and I appreciate very much the alacrity with which we have got through these 3 items following the substantive items earlier in the agenda. So thank you for that. Okay, so we're now moving on to item 9 on the agenda, which is items for information only and for noting. But what I will do is, conscious Jackie Pepper has been with us all afternoon. Jackie, do you wish to make some brief comments in relation to the Chief Social Work Officer Annual Report 2019-20?
Thank you very much, Chair. This is a report, and I'll keep it very brief because I'm aware that we're over time already, but this is a report that would normally come to Perth and Kinross Council in December. It has already been to Council in October because I was keen to get an early report that covered our work over 2019-20 and the first few months, or really the first half of our response to the pandemic. And you'll see that I'm pleased that there's a whole wide range of information and performance information and impact information across this report. And it picks up on some of the issues that we've already discussed earlier around the impact on staff and how they've managed to be resilient and rally and manage this both in the immediate shorter now into the longer term. The report highlights some significant demand pressures, particularly in children's services, which have been addressed since the report was written, in that the Council approved the equivalent of 4 additional full-time equivalent social work staff into children's services in order that we can deal with the statutory requirements associated with looked after children and the pressure on child protection. At that time we weren't seeing significant demand at the front door of social work services, but my most recent information is that some of those latent issues, particularly around people who are experiencing distress and mental health, are coming to the fore now. So it's certainly something to keep an eye on, and perhaps some more up-to-date information at a future meeting would be helpful in that respect. But I'm happy to address any questions or pick up privately or by email following this meeting if anyone has any specific areas that they would want to consider in more detail.
Okay, thank you, Jackie. Just picking up on her final comments there. There is, of course, an opportunity to ask questions and comments, make any comments just now, and the offer is there to, if you want to ponder and come back at a subsequent date by email to Jackie, then you should all be very welcome to do so. Are there any questions at the moment or comments? Again, I'm not seeing any. Thank you, Jackie.
Thank you.
So item 9.2, therefore, is the IJB reporting forward planner 2020-21. And Gordon, if I can just ask you if you have any comments to make in relation to that paper.
Only insofar as it's been revised to reflect the reports that we weren't able to consider today, and those are brought forward to the next IJB. We are in the process of beginning to try to establish the dates for the IJB meetings and the development sessions for next year. And we need to obviously not clash at all with NHS meetings and council meetings. We have the timetable from the NHS, and the timetable for council meetings is being worked up. So as soon as we have that, we will make the dates available to IJB members.
Right, thank you, Gordon. And with one sentence, you've covered 9.2 and item 10, so thank you for that. And if there are any questions at this point or comments to Gordon on that. Comment from Councillor McDade.
Thanks, Chair. I'm sure you and the Chief Officer will both guess what my comment is going to be. It's the same comment I make at every meeting, and will continue to make at every meeting until we get a resolution on it, which is I think we definitely need more IJB meetings scheduled, and this is obviously the pertinent time to do so, given the level of workload the IJB has and the length of the agendas, and indeed we've deferred items from today's agenda. I think that is, and we do that on a regular basis. I think it would be pertinent at this point, when we're considering the calendar for the next year, to make sure that we add in a couple of extra proper IJB meetings to allow us full time to consider matters. So if I can make that plea as usual, and I will, as I say, continue to do so until we manage to resolve this. So thank you.
Thank you, Councillor McDade. And yes, I had been anticipating some sort of comment like that, and we will certainly reflect on that as part of the planning process. We are genuinely, as you know, waiting for council dates, etc. And I think what adds to the pressures sometimes is the close proximity of IJB dates to NHS board dates and full council dates, and it just all compresses together. And so, we will try within the dates available to make as much time as is necessary available to board members to discuss and properly scrutinise the very important work that the Health and Social Care Partnership is doing. So your comments are duly noted. If there are no further comments on that report,
can I make a kind of general comment, Chair, if I may?
Pat, yes.
Yeah, it's just that I would like to hear and see more of the Associate Medical Director at IJB meetings. I think that would be a really valuable contribution. I know he's probably a very busy man and has a lot on his plate, but I think it would give us direct access to someone of that calibre, with that kind of background and that kind of understanding of what's going on across Perth and Kinross from a clinical perspective. And I think that would be really useful. It's just a personal perspective on that. I find when the medical director comes to he's in lots of meetings, but when he comes to clinical governance, we get an additional perspective than we do from the chief nurse. So these are complementary roles. So I think it would complement the other inputs that we're getting, and I think it'd be very valuable.
Yeah, I take that on board, and that will be reflected back. And certainly at the next meeting, when we do come to discuss clinical care and professional governance, it's particularly important that he is present for that particular discussion. So, but yeah, in general, I agree that that's certainly an ambition that we need to try and pursue. Thank you. So, The final item on the agenda today, therefore, is 9.3, the Tayside Winter Planning Report 2020-21, which has been with members since the papers came out last week. And again, Gordon, I don't know if you have any very high-level comments to make on this before inviting comments from members.
So this is really just to seek the approval of the winter plan, or sorry, the noting of the winter plan by this IGB. IGB members will recall that we did provide a specific report on Perth and Kinross health and social care partnerships, winter preparedness, and effectively that is our contribution to this Tayside-wide report that you have before you today. So the expectation is that these reports, the winter plan, be noted by each of the IGVs, ideally perhaps sooner than today, but this is the first time we've had the opportunity to do so. And it's in Angus's IGB today, and it's going to Dundee's next week. So it's really just for noting, but if there are any comments, I'm happy to try to address them.
Thanks, Gordon. Are there any comments? No, okay. Let's agree to note that report and thank you for that update, Gordon. Okay, that brings us to the end of today's agenda, and not too bad. We're 15 minutes beyond the anticipated and hoped for 4 p.m. closing time, but we have covered a significant amount of material this afternoon, as we always do. So I would like, without further ado, to thank all members of the board for their contributions today. I would especially like to thank Gordon and his staff at the Health and Social Care Partnership for their unwavering commitment and effort throughout an unprecedented year of challenge, which is likely to continue for several months yet, at least. But I just want to place on record the appreciation of everyone on the Integration Joint Board for their efforts and commitment, and finally to wish you all a happy Christmas and a safe Christmas, and please God, a better new year in 2021 than 2020 has been. Okay.
Could I please update the committee just very quickly before we close?
Yes, Sandra, of course.
Thank you very much, and I absolutely echo your good wishes and your thanks to everyone that's worked so hard this year. I just very quickly wanted to update the board that the Carers and Service Users Reference Group met a week ago today, and we've been working very hard. Everyone's been working very hard behind the scenes to try and attract new service users and carer representatives. And that tactic seems to be working, and I'm hopeful that some of the people that attended the meeting last week have dialed into the meeting today to get an insight into how the board works. It was disappointing that the papers for today's meeting weren't available by the time that we met. And because it would have been good to use those as an insight into the work of the board. There were 17 attendees at the meeting, and 17 apologies had been received. So you'll see from that that's a big increase in interest in the reference group. We discussed the replacement and the election of new members, and that will take place in January, providing that this board are happy with the process that has been suggested, and that's really all I wanted to say. I just wanted to update the board on our progress with the reference group.
Okay, thank you for that, Sandra. That's much appreciated. And Gordon, I don't know if you want to come back and on that and how we can take this forward early in the new year.
No, just to acknowledge that, and I think that's a really helpful, important contribution. I mean, it may well be that officers out with the IJB process, officers from the Health and Social Care Partnership could join those meetings. The other, not join all those meetings, be invited perhaps to some of those meetings. The other way in which we would perhaps be looking to do this, Sandra, is I'm very keen that when we get some breathing space and capacity, that we resurrect and revitalise our strategic planning group, which sits below the IJB and is a statutory group that should be reviewing, challenging, providing a critical friend and being part of the engagement and consultation around the development of our local programmes, plans and strategies. So I think that also potentially creates an opportunity for people who have lived experience as carers or service users to be connected into those processes and indeed perhaps to be active participants or even chair such a meeting. So we will be bringing forward proposals around what that might look like, and that will be include within it our ambition about how we can better support the third sector forum, as well as service users and carers who can be so key and influential in developing our strategic direction. So I think we should look forward to some developments in that regard again in the new year.
Well, thank you very much for that, and for the offer of attendance at the reference group meeting. That part of the discussion we had was to extend just such an invitation to members of the IJB, so that would be fantastic. And also there was, having just seen Lindsay Bailey's presentation a few days before, it struck me that would be a fantastic opportunity for the reference group to witness some of the terrific work that's ongoing. So yeah, thank you very much for that, Gordon.
Okay, good stuff. A positive note on which to end, and again, happy Christmas to everybody, and we shall reconvene in 2021. Thank you and good afternoon.